the strangest Friday I've ever lived through, probably. Good morning, Guam.
Good morning.
Thank you. It's the KUAM News takeover of I-94 containing COVID, 6 a.m. on a Friday morning. And there's so much to tell you guys this morning about the COVID-19 virus, its impact, the response, new results that are in. How late was it that we got these new results?
7:15 p.m. New results. I just got home and my WhatsApp chat, our news team WhatsApp chat was blowing up, and when I finally looked at it, I was just in shock.
Right. And so what we're noticing is when we get the information later, it's usually positive results. And I was talking to Carlo Branch yesterday, and that's because they when they get a positive, they rerun it to make sure, I guess.
So if you didn't hear by now, there are 4 more positive cases of COVID-19 on Guam. That brings the total number of confirmed cases on island to 12, and a total of 81 tests that have been performed to date.
Right. So that's where we're at this morning on Friday. Bigger news that came down a little earlier yesterday was the governor's order basically giving the people the lockdown that they wanted.
Right.
And so
12 noon today, right?
Right.
The countdown has begun.
The order goes into effect at 12 noon. And basically, it is a shelter-in-place order. There are some exceptions. I know you got the release on that, Bree.
Yeah, there's quite a few exceptions. The social isolation directive goes into effect at 12 noon today and will remain in effect, I believe, until the 30th of March. And I know once the order came out, we actually didn't get it from the governor's office. We got it by way of the legislature.
Yeah.
And thank you to Chirag and the speaker's office for sending that to us when they did, because we had no clue. We hadn't even heard from Adelup for most of the day.
Right. And so what I think is interesting about that, Sabrina, is that over there at the legislature, when the governor comes out with an executive order as a matter of protocol, they send a copy over to the speaker's office. And that's why we were able to get it. And I don't know if they were just saw how important it was and put it out and maybe didn't realize, Adelup hasn't even said anything about this, because when we got the order from the speaker's office, of course, we immediately shot it out to the Adelup people, and they were like, we're preparing a statement.
Right, a special address, and that was maybe 3 hours later, or however many hours, I'm losing track. But yeah, we finally got the special address reiterating what was in the executive order. But by then, we already started informing the community that you need to know that at 12 o'clock tomorrow, businesses are going to shut down with exceptions. And even that, when we got the executive order, people were calling wanting clarification. Well, does it apply to hotels? Does it apply to restaurants? And we also needed that clarification. We were, we had to wait for the special address to come out. But regardless, we do have the guidance from the Department of Public Health in terms of how it applies, who it applies to, and we can go through that, or you can also find it on our website, because there's an extensive list here, and I believe we already have somebody on the phone.
Do we?
No, we're trying to get somebody.
Yeah, we're going to get Mayor Hoffman to kick off the show this morning.
Okay, so I'll go ahead and read what we have from Public Health. The purpose of the social isolation drive is to limit gatherings of several people in an effort to limit the spread of COVID-19. When in doubt, for the sake of public health and safety, any space that encourages social congregation or gatherings should close. The following guidance is provided. Essential business means healthcare operations and essential infrastructure. Now, these are the businesses that will remain open or can remain open during this shutdown period. All right, thanks, Jace. Exceptions to the order include healthcare, essential infrastructure, banks and credit unions, grocery stores, pharmacies, gas stations, auto repair shops, garbage collection, hardware stores, laundromats, and food and takeout or delivery. And again, those will remain in effect until March 30th. Newspapers, television, radio, and other media services will also.
So we're essential.
We're essential.
How does it feel to be essential, Sabrina? Feels pretty good.
Laundromats, dry cleaners, and laundry service providers, restaurants, and other facilities that prepare and serve food, but only for delivery or carry out. Schools and other entities that typically provide free food services to students or members of the public may continue to do so under the executive order on the condition that the food is provided to students or members of the public on a pickup and takeaway basis only. Schools and other entities that provide food services under this exemption shall not permit the food to be eaten at the site where it is provided or at any other gathering site. So we're looking at takeout, right?
Yeah.
Businesses that supply products needed for people to work from home, businesses that supply other essential businesses with the support or supplies necessary to operate, businesses that ship or deliver groceries, food, goods, or services directly to residents, airlines, taxis, and other private transportation providers providing transportation services necessary for essential activities and other purposes expressly authorized in the executive order. Home-based care for senior or adults, residential facilities and shelters for seniors, adults, and children, professional services such as legal or accounting services when necessary to assist in compliance with legally mandated activities. As for healthcare operations that are exempt from the executive order, we're talking about hospitals, clinics, dentists, pharmacies, pharmaceutical and biotechnology companies, other healthcare facilities, healthcare suppliers, home healthcare service providers, mental health providers, or any related and or ancillary healthcare services. Healthcare operations also include veterinary care and all healthcare services provided to animals. Healthcare operations does not include fitness and exercise gyms and similar facilities and daycare facilities. Essential infrastructure includes, but is not limited to, public works construction, construction of housing, in particular affordable housing or housing for individuals experiencing homelessness, airport operations, water, sewer, gas, electrical, oil, refining, roads and highways, public transportation, solid waste collection and removal, internet and telecommunications systems, including the provision of essential global, national, and local infrastructure for computing services, business infrastructure, communications, and web-based services, provided that they carry out those services on that work in compliance with social distancing directive to the extent possible. Non-religious funeral services are permitted, provided they are limited to immediate families. Hotels will be allowed to continue limited operations to allow their guests to stay in their facilities, but non-essential operations such as bars, ballrooms, fitness centers, and swimming pools are not permitted to operate. Places of worship are asked to cease public attendance at regular services and to limit funeral attendance to immediate families only. Vehicle rental businesses are permitted to operate. Distributors, wholesalers, and providers to essential business may continue operations. Public spaces, beaches, and walking, running trails will remain open, and outdoor activity such as walking, hiking, or running is permitted, provided that individuals abide by the social distancing directive in the executive order.
And that is no groups bigger than 50 people, and also a big part of the 6 feet between you and the next person. Thank you, Sabrina. So that's the order, Executive Order 2020-05, coming from the office of the governor. She did put out a special address, and I think we're going to play that. We are going to play that. Yes, we are. And we're also going to get Mayor Hoffman. Man, there's a lot of stuff going on this morning as people are really trying to get out and do what they got to do before this order goes into effect. And although there are a lot of exceptions, I think most people are going to treat it like a real shelter in place. And
I hope so.
Yeah.
I mean, there's a reason for this. It's because of what's happening in our community and around the world. So please take heed in what the governor has ordered. And stay home, stay indoors, and if you need to go out, it should only be for
essential. If you need to get groceries, which I don't know, you guys went panic buying earlier in the week, so you should be good. But I mean, just get what you got to get and prepare as if you aren't going to leave your house until March 30th.
Right. I actually need to go grocery shopping.
Yeah, so we got some stuff to do after the show.
We've been here early in the morning and leaving,
Right.
I
went to a store yesterday and I picked up some stuff, and it was one of these stores. You see them, people were talking about it on Facebook. You need a mask to go into this store. Like, no mask, no entry. And so I really felt like I was in a secure environment, though, because I put on my mask. I was walking in. They had a guy with disinfectant outside, a little spray bottle. And then when you walked in, they had a little hand sanitizer pump and some wipes. And, walking around in the store, everybody was wearing a mask.
And I think that's a good thing.
Yeah, it's pretty cool.
It's a really good thing.
It used to freak me out because, over the years, usually the tourists, like you would see tourists going around, a random tourist going around with a mask, like, whoa, what are you wearing? It kind of made you, raise your anxiety. But I was wondering when I left the store, is this just going to be how it's going to be? Or are we just going to wear masks from here on out? Right? I mean, because there's going to be another pandemic. Let's deal with this one first, right? So 610-637-0094 is the number. We're going to take your calls. We got to take a break, and we'll come back with Mayor Robert Hoffman of Sinania. It's containing COVID, the KUAM News Takeover. Good morning, Facebook. We're going to be reading your comments, so you guys put your comments on the live feed, and we'll get to reading some of those. Some of the people we got lined up for this morning, Major Joe Blas from the Guam Guard is going to call in. I know a lot of parents are thinking about ways that they can make this fun for the kids.
Yeah, during this quarantine.
Right.
So we have Adele Demlanta. She's from the Gate Visual Arts. She is a Gate Visual Arts resource teacher. She's going to be talking with us to discuss simple challenges to help keep young children engaged in creative arts during this quarantine period.
Right, because a lot of people are wondering, after 3 days of your kids playing video games, pretty sure their brain is rotten. You want to find some fun educational things for them to do. Well, you keep listening.
That's right.
Okay, guys, I just want to jump in from the outside. You were just talking about the panic buying and everything. Nestor Lecanto has been working feverishly, and scheduled today we should have an interview with one of the shipping companies to allay concerns and just let people know, what is the status of inbound goods, and that supplies will be restocked and everything. So he's working on that, so we should have that this afternoon, and that's going to be live on Facebook. So everyone, please tune into that, because that's going to be a good discussion and answer a lot of your concerns.
Well, there you go. I'll tell you,
Salas.
when I was at that store yesterday, while I was shopping, they were opening boxes and restocking shelves. So what Jay's kind of referencing is the Chamber of Commerce has come out and said, hey, we've looked at our shipments and everything's on tap. And so that's that. And Nestor Lecanto will look at that. So I guess do we have hand sanitizer? Any hand sanitizer come in?
Clorox wipes, Lysol. It's crazy, right?
Yeah, it is. It's 6:12 Friday. KUAM News Takeover containing COVID. Good morning, Guam.
Off a day, a lot of people are talking about the coronavirus or COVID-19. Many of you
Be healthy. Be informed with ITD.
half a day, ladies and gentlemen, and my name is Andy Wheeler, and I'm broadcasting here from the I-94 FM studio. And I'm a broadcaster. I've been doing it for over 20 years, and I'm used to going into work, doing my show, broadcasting to you, giving you the information, giving you entertainment. But I have to work from home. I'm under quarantine, as many of you are, and now we're not really sure what that means, the executive order that's out.
An essential business that can remain open during the governor's lockdown. Private transportation.
Right.
There you go.
And the lockdown goes in effect at 12 noon today. And this, just to clarify, this is a mandatory isolation. This isn't a lockdown where we're talking about the flights coming in.
Yeah. This is you stay in your house, try your best not to leave your house. I got a basket of laundry I got to do.
I got a lot of stuff to do.
Yeah. So we're going to try and do this, and then we're going to try and do that, but really just want to get you a lot of information out here. We now have 12 confirmed cases of COVID-19. Bree, did we get any other information? So they announced last night four new positives.
Right. And 4 additional positive cases. Now, of the 4 cases, 1 had travel history. Additionally, the 3 results confirmed on Wednesday had no travel history. And that really is concerning. And we don't have any other information. I don't even think we ever got information on the 3 that were confirmed yesterday in terms of whether they had travel history or any sort of connection between any of the confirmed cases.
A little bit of a backlog in the information that we're getting.
I don't even think it's a backlog at this point. It's just
so, one thing that Dr. Shea had, I guess he had sent an email over to Linda DeNorsi, the director of public health.
Let's see if I can find that.
He was talking about the type of information that the government of Guam is releasing about these COVID-19 patients. And it's very little. Basically, they're just saying, hey, we tested people and this is how many were positive. But if you look in media reports of other areas, other states, other countries, the way they report and the amount of information they report about these patients, it's a lot more information.
It is. Here it is, Dr. Shea. Like in Hawaii, for example, their Hawaii Department of Health, this was a press release that they issued on February 14th, and they actually give information in terms of like gender. An adult male who traveled to Maui from January 28th to February 3rd and to Oahu from February 3rd to the 7th has been confirmed for COVID. The individual is a Japanese national who developed severe symptoms, sought medical care, and was diagnosed and tested after leaving Hawaii and returning home to Japan. The individual had no symptoms while traveling on Maui and developed cold symptoms with no fever while staying on Maui.
Right. Okay. So this is the type of information
you want to hear what
we want to get from Carlo Branch, from Governor Lulian Guerrero, from Crystal Paco San Agustin, from the Joint Information
from
Center.
From Janela Carrera, the communications director.
Yes. So this is what we're not getting. This is the type of information the people of Guam need to have. We need to be armed with the best information, the most information, so that we can act accordingly. You know what I mean?
I definitely know what you mean. I think you and I have been
it's frustrating.
going over this.
Broken record already.
Yeah.
So 618, we got a call here, 637-0094. This was something that was kind of going around on, I guess, WhatsApp, ma'am. Good morning. Okay, anyway.
We lost her. Okay.
Yeah, so I just want to address this right out of the gate because I was getting a lot of messages. There's no verification of that video or audio that was going around on WhatsApp about the Guam Memorial Hospital. Really unfortunate that was spreading things that aren't true or aren't verified is spread around like crazy.
But my issue with that is, it's circulating on WhatsApp. It's posted on social media. And I asked for, some sort of a response to this, whether or not it was valid or invalid. And I got no response. But yet the Joint Information Center issues their JIC tip and discrediting another information that was circulating on social media about the Red Cross, and I think it was a census or something. But you're quick to dispel and discredit that, but when you have something more severe and circulating, there's nothing.
Right, and so they need to if these things are not true and they're not verified, then they need to come out and say that. in a timely manner, because what ends up happening is people are not getting the information from the government. They're not getting it from the governor. It's been very, very slow in coming. So when you don't have information, what information you do get, you probably put a little more, stock into.
And I really do not buy that we're so busy or we're working, we're tired, because we are here at 5 in the morning and working late at night, just like everybody else that's working in this business.
Yeah, we're all working. I mean, now is not the time to be,
kudos to all the media that are having to endure this.
And that's the thing, it's not just us. I thought it was just a personal, maybe the governor was mad at us or something, but it's not. You talk to media colleagues across the board here on Guam, and they're all really facing the same struggle, which is so unfortunate because we've got no shortage of staff there. At the governor's office, they can task somebody, they can tap somebody, and anyway, it was very frustrating. We're going to have Carlo on the show at 7:30, and we're going to get the governor's address. Let's go ahead and get this special address from Governor Lulian Guerrero. Thank you for watching on Facebook. Again, 637-0094. If you guys have questions, comments, concerns about the impending order that goes into effect at 12 noon. And right now it is your governor of Guam, Governor Lulian Guerrero, with her special address from yesterday afternoon.
Half a day. For the past few weeks, Guam has been engaged in the global struggle against the COVID-19 virus. On my direction, this government took extraordinary steps to keep Guam safe, and I told you I would take further steps when they were needed. Last Saturday, I declared a public health emergency in response to the global threat of COVID-19. Locally, we have performed a total of 65 tests. Of those tests, we have confirmed 8 positive cases of COVID-19. Each remains in isolation and is being monitored by healthcare professionals. Some of these individuals are symptomatic and over the age of 60, our most vulnerable population. Some are younger and asymptomatic. Some have recent travel, others do not. I know many of you have asked me to ban all flights coming into Guam. I will do anything in my authority to keep our people safe. However, shutting down our airport is not within that authority. What I can do is implement a mandatory quarantine for all incoming passengers. That is why I ordered that all travelers seeking entry into Guam provide test results indicating they were COVID-19 free within the last 72 hours. It is why we quickly stood up the skilled nursing unit, now known as COVID isolation, which is open today. I also activated the Guam Army National Guard to provide support and ordered restrictions on social gatherings. I also sought the advice of experts each of us can trust. Dr. Mike Cruz has been activated as the Guam Army National Guard State Surgeon. He is also the signatory of the 2008 Guam Pandemic Response Plan. Dr. Jolene Uggan, our COVID-19 Medical Director, is a specialist in pulmonology who will help coordinate our EMS response. We have also activated nearly 50 school nurses to assist our efforts. These nurses are helping with airport screenings, public health surveillance, working at our health centers, and answering our hotlines. Each of the actions we have taken is to protect you, but now is the time for more. I am again aggressively escalating the protection of our island. Effective Friday, March 20th at noon, all public spaces in which people come together for food and beverage, entertainment, recreation, and leisure will be closed until March 30th. This means bars, dine-in restaurants, theaters, and others. This social isolation directive will also apply to shopping malls, retail stores, fitness centers, and outlets. but certain essential services will remain uninterrupted. Pharmacies, clinics, convenience stores, and gas stations will remain open. And although dining in restaurants will be prohibited, you can receive takeout or delivery. With these developments, strong measures need to be taken. If you are young, healthy, and have mild symptoms, you can still spread the virus. Social distancing is meant to keep all of us healthy, especially the most vulnerable among us. The public must limit their movement and stay home. I know that many of you will have questions. For more information, you can call 475-9473 or 475-4770. In any struggle for the things that matter, the people and island we love, there will be good days and bad ones. There will be moments of triumph and sadness. There will be victories and losses. We might mourn, but we will prevail. We will do it all together.
Guerrero with her special address that was put out yesterday afternoon, hours after an executive order calling for a social isolation mandate was released. Mayor Hoffman, let's get Sinania Mayor Robert Hoffman on. Good morning, Mayor.
Hey, how's
So just real quick, yesterday on the show, Dedito Mayor and the president of the MCOG, Melissa Tavares, told us that a mayor of a central village was approached by public health and told that there was an event in that central village, and there was someone that attended that event who tested positive for COVID-19. And we now know that you were that mayor. So, Mayor, could you just take us back to the beginning and maybe walk us to where we are now?
Sure. Thank you. That is correct. So on Monday, I guess the governor declared the state of emergency and then announced on over the weekend that 3 people have tested positive. So on Monday, we were contacted by the Department of Public Health and just informed, said, Mayor, we're doing our tracing and our backtracking, and the person of interest, a person under investigation, probably went to your center. We're just double checking, and we wanted to see your, attendance records and your logs. And so, we said, sure. First, we kind of got really panicky and scared, and we're trying to see my parents go to that center. And so we pulled our logs, we kind of put everything together, got the contact numbers for them, and we asked, what specific days, or was it a week, or what days did you want? They said, just last week. So, we did that, and we provided that for them, and they've been calling our seniors, checking up on them, asking them questions about their health and their temperatures and stuff like that. They asked us some questions if the person of interest was showing any symptoms, and we don't know who they were, so we're like, you need to tell us who they are so we can tell you if they were showing symptoms or not. But I understand all the rules, whatever else that happens in that place. So they weren't able to do that. They weren't able to divulge any information of whatsoever. So I've been trying to get a hold of, I get a hold of them, and I asked them, I said, any did you find anything happened? They said, they're like, no. And we've been in contact with our seniors because of the meal program, and everyone that we talk to is at home and they're there. So, praise the Lord. We don't think that any of our seniors got caught with anything, but, I really am impressed by public health's ability to backtrack and go everywhere, that they suspect.
And yeah, Mayor, this is some very good information, I think, because we haven't heard anything about the trace investigation. And can you provide any more detail on how what you were able to glean and how the investigation works from your interaction with them?
Sure. They once they get the numbers, they just make a contact to each of the seniors, and our seniors got scared, and they were trying to figure out who it is and what's going on. And some of them, naturally, they're always coughing because they're ex-smokers or something. So we're like, oh, is it that person? Is it that person? We're like, no. And so it's just so happy, we were like, okay. And then we did ask if the person was from Sinahanya. I said, I would like to know, is the person from Sinahanya? And from what we were able to gather, no, they're not from Sinahanya. They don't live here. They're not from this village. So,
Mayor, were you able to figure that out on your own, or was that something that public health told you?
We figured out on our own.
Okay.
on it based on the attendance records of what we were trying to do and stuff. And so we just wondered, like, did this person go everywhere else? What part of the building did they go to? You know, it's hard because I guess the person under investigation at the time, they didn't know they had the sickness, the disease, and they could have gone everywhere else too. So, you know, it's at least for us in our part, the kind of the relief of what we know is that we have records. But, you know, if this person goes to a restaurant or to, I know, and that's why I think that self-isolation, self-quarantine is very important, because, you know, we don't know where this person went, and you could, you know, the possibility of exposure is greater when, you know, you're around these facilities. So what we did as precautionary and decontamination is we just cleaned out the whole senior center. You know, we Cloroxed everything and did our whole due diligence on our part there. And public health was Salas actually doing this, because they came back later on just to get some other numbers, because some of them weren't working.
Right.
And they were like, wow, you guys are very quick and fast. I said, hey, if you said something was here, we're going to make sure that, you know, we want to clean it here. So, you know, we just pray for those people, those 12 people now and their families, because it is hard, because, you know, nobody knows how or where these things are coming from.
Yeah, Mayor. So, and again, they kind of put out the HIPAA things, but as a mayor of a village, I'm pretty sure that your residents your phone's ringing off the hook. You know, people are concerned and they feel like they have a right to know.
Yes, and I agree. And all our colleagues in our chats that we're talking, we've been asking, and we want to know. I mean, we said, you know, and we keep citing, you told us where the dengue was. That's the only way we were able to respond to it quick enough to kind of get these areas. So we don't understand why it's different for this specific. You know, I think people want to know to either, one, avoid it, and, you know, two is that they can take the corrective action. We think that, you know, people at this time, if they're home, can take that opportunity to clean and to get checked, and to also figure out, hey, did I go there? Or is this my village? You know, do I feel safe in a way that I can monitor my own symptoms? And I think that's why it kind of grows, because they said for every one person, they can infect 2.5 people, and that just keeps growing in that way.
Yeah, but, you know, Mayor, I mean, on Guam, I don't know if that's a number from the States where there might not be as much interaction, but here on Guam, I think that we interact with each other way more, kisses on the cheeks, embraces.
Exactly. And that's the hard part, especially with our seniors, because they're the most susceptible, is that they do that, and that's a normal practice for them to just embrace each other. So I know this period right now, this for them staying home is really hard for them. And when I talk to them, and we talk to them about their food, and we give it them, we're offering them. All we're asking the people of Guam is just check your neighbor and go out there, because it's really lonely for them to not have contact other than their family. And I think they've missed that. They missed that socialization which we got at the centers, and you know, their gangs at McDonald's, or they would sit there in the morning and for all hours, or the restaurants. So, you know, we're just asking if at all possible, check your neighbor, whichever. You know, you can talk to them through the screen door or the window, but at least let them know you're around and that we care about it. So we're trying to cheer them up as much as we can.
If you could, Mayor, hi, Sabrina, I just wanted to get a little bit more clarification. So you were notified on Monday, correct?
Yes.
And when was this gathering? Was a party at the Senior Citizen Center?
There was a birthday party on Thursday. So they just asked us for the 10th to the 13th day. So we gave them just the whole week's records of what it is, you know. And the thing is that, you know, it doesn't, I guess in this specific instance, they don't say how long. I mean, we know how long people come to the center, but you really can't tell, like, a ballpark figure, like they sat here for 8 hours or not, because, you know.
Right. Who's thinking of that stuff, you know? I mean.
Yeah. So we're like, okay, they appeared, but, you know, we're trying to figure out, you know, is a 10-minute visit long enough to infect X amount of people? Is an hour visit? Is a 3-hour visit? And, you know, we're trying to figure out, like, who. All the seniors are asking themselves, like, anybody sick? Is it the person I sit next to? Is not. So their families naturally are concerned. We are concerned. Like I said, my parents go there, and so I'm checking my mom and dad. I'm like, Mom, how's your temperature, Dad? You know, is everything okay? They're like, we feel fine, boy. We want to go bingo. I'm like, I said, stay home. I don't need to worry about you.
How many people were at the party?
About 70 people.
70 people at the party.
Yeah, well, 70 in attendance for that whole week. So
okay, that's
kind of what we were able to gauge and give them. Actual people in the party, I'm not sure, because, like I said, some people come in and left before it. Some people, you know, it's just like a drop-in type situation with most people.
So just outside looking in, we know that they're probably still, I'm assuming, conducting the trace investigation from the flight where we had those 2 positive patients that had come in on a flight, and then working on this, trying to reach 70 people and whoever I mean, wow, public health has got to be very overwhelmed right now.
Yeah, and I know that they're using the other divisions to contact, because I think my parents were contacted by the immunization division, and the other half of them was contacted by the Bureau of Communicable Disease division. So it's just, I think public health's utilizing everybody they could, but from what I know, they didn't come back to me asking me for new phone numbers. So I'm suspecting that they were able to get a hold of everybody within that day and a half.
Mayor, what are your colleagues saying? I was able to speak with Mayor Jesse Gogwe a couple days ago, and he had said that the people in his village are talking about possible COVID-19 positive living in the village. Are your colleagues, your other mayors, are they sharing these concerns where they feel like they need to have that information to take back to the residents?
Yes, and we've asked that. We asked it again. We made the plea last night. I made the plea directly to Linda Norcy last night as well. And she said once they're done doing their trace and they can figure this out, that's, I think, the hard part, because things are very fluid for them. So I think they're just trying to get a situation, a grasp of what's going on. I mean, if you say what village, and you say, okay, possibly, and you release 100 names of flight, it manifests. That's pretty much every village. So I think they're trying to figure out exactly who tested positive, which and that. And every time we always find out there's somebody new, I personally, I send text saying, is it anybody from my center? Or is it anybody that, then they're like, no. I'm like, okay. So at least my concern is kind of my fears are relieved by knowing that. And like I said, every day that we make in contact with our seniors, that's how I know they're not in isolation there up at GMH.
Yeah, I was going.
It's hard.
Mayor, so
wait, I did want to ask. You said you spoke with Linda Norcy last night. Was this in the a briefing,
no,
or
just
you just
just me and her were doing a quick text about it, because I said, Linda, please let me know. I think our villagers are asking what village is going on. And I'm hearing things that people are texting me sometimes saying, hey, Mayor, I heard there's 3 from Sinanya. I'm like, that's news to me. So I asked her, and she says, let's finish the tracing, then we'll get back to you.
So for the most part, the village mayors have been kind of left out in the dark and not knowing anything?
We've been asked, they keep citing different rules and laws, but, we keep coming back to them about the dengue and all the other stuff. I said, you guys keep, you basically, for dengue, you've asked us and activated us to clear everywhere that we figured there was standing water and all these other things. So we didn't understand what the difference was.
Right.
So what was the response?
They said, we'll get back to you.
Right, and I'm getting the feeling that thinking about how many people have come into contact with people that they were looking at the trace investigation. It's got to be huge.
Yeah, and I think that's hard, because if the individual, I hear the individual may have went to weekend mass. I said it's in hundreds. Like, no, somewhere else. So I'm like, okay, they don't keep attendance records at church.
Right.
Yeah.
So how do we know specifically? And so, at least in some of those instances where they say that person may have been on the flight, at least those family members and those people, they can all say, okay, I was on a flight, and there's a record, there's a manifest of it. But if these people went to different activities, different stores, different clinics, that's where I think it gets really difficult to kind of figure out, how do you trace that?
Mm-hmm.
Mayor, what's your village saying about the order that's going into effect at noon? Are people running around trying to do everything so they can hunker down?
It's been pretty peaceful. We're pretty. I'm pretty happy about people being very cooperative of it. The difficult part is people who work for the federal government and our military. They're, some of them are trying to figure out, like, what about us? What do we do? And some are saying we should close the roads down and everything like that. But people generally have stayed home. Even our young people, I'm pretty impressed that they haven't got out to different areas here. They haven't attempted to. So we're pretty decent with the response of how people are treating this. And we're telling people, we're trying to figure out activities. So
right.
Mayors were like, maybe we should just ask everybody to go outside their house, around their block, just pick up litter.
While you're at it, right? Hey, while you guys are on isolation, clean your area.
Yeah, that, or plant a tree or something like that. So we've noticed people doing their lawn a lot more, and doing some really nice landscaping around the areas there. So I'm like, okay, this is pretty neat that they're
Right.
finally kind of getting to projects that they put off for a while. But it's no vacation for a lot of the other workers who were there. And, we're, some of the suggestions were is that if we can figure out a way to kind of get into the schools as well and just use this time to kind of clean up.
Right. Well, Mayor, I know you guys do a Zumba thing, so maybe you could do like a virtual Zumba or something.
We did. We
Oh,
started
wow.
last night.
Wow.
So it's on Team Zinahanya with a Z, and you can go on, and Ken and Augustine's are certified Zumba instructors, so from 6 to 7 o'clock, you can go on there and you can have Zumba from home. And last night we had 21 people watching, and I know because my mom's one of them, so she was Zumbing from her living room.
We got to
Yeah.
send, you know
Yeah.
what, you should send video of your mom doing that, and we
Yeah.
can post that.
I will. I'll let her know.
Okay, Mayor, thank you so much. We got Mayor Jesse Gogui on the other line, so I know that you're trying to bang out a funeral this morning, right?
Yes, that's right. I got to do an escort and stuff like that. So that's the hard part. It's our culture. So how do you tell people not to hug somebody and give condolences?
Yeah.
Tough one, Mayor.
Yep. All
Okay.
right.
Be
So-
safe.
Take care.
Yeah, Mayor, wash your hands.
You too. Thank
Okay.
you. I will. Bye-bye.
Oh, there you go. Sit on you, Mayor Robert Hoffman. And let's just go over to Orna Chalampago. Oh, this darn thing here.
Rusty.
Yeah, let's get
Rusty.
Mayor Jesse. It's equipment error at 637-0094. Containing COVID, watching us on Facebook. Good morning on you. It is Friday. And some of the guests we got lined up for you this morning, we've been told that the governor's director of policy, Carlo Branch, is going to be calling in to the show at 7:30, putting our list of questions together. We're going to read off some of your comments on the Facebook live stream coming up next, right here on Containing COVID. Good morning.
Good morning.
Off today, a lot of people are talking about the coronavirus.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
All right, half a day, ladies and gentlemen, and my name is Andy Wheeler, and I'm broadcasting here from the I-94 FM studio. And I'm a broadcaster. I've been doing it for over 20 years, and I'm used to going into work, doing my show, broadcasting to you, giving you the information, giving you entertainment. But I have to work from home. I'm under quarantine, as many of you are, and now we're not really sure what that means, the executive order that's out. What does it mean? I don't know. But a lot of us are social distancing. We are isolating ourselves.
Containing COVID, KUM News Takeover. Good morning, Guam. Friday.
Half a day.
Let's get right to it. Mayor Jesse Gogui on the phone. Good morning, Mayor.
Hey, good morning, Craig.
So we spoke a couple days ago, and we just got off the phone with Sananya Mayor Robert Hoffman about some of the mayors, and they feel the need to know if any COVID-19 testing, any COVID-19 positives have come from their area. So can you kind of share what we talked about a couple days ago about just what you've been able to glean from what your residents are saying, and if there have been any new developments in what we talked about?
Well, I kind of agree with all of the other men, and that it would behoove us to be told whether or not we have any of the positive cases, whether or not any of the positive cases are from our villages. And there have been rumors that there's been one case from my village, but once again, there's been no confirmation from official confirmation that is in fact the case. And so, I mean, it is kind of frustrating to some extent, but by the same token, I try to focus on what I need to do, and that's just to try to keep the people calm, and try to answer the questions that they may have that I can answer, or that my office can answer in the best way we can.
Mayor,
So no confirmation. Confirmation.
No official confirmation, of course not.
Right, and so that's interesting because Mayor Hoffman was able to get official confirmation. Have you
For his village?
For his village, yes.
Yeah.
Oh yeah, I've gotten no official confirmation. So, I mean,
But you've confirmed it.
Well, no, I have not confirmed it.
Okay.
I mean, there have been relatives from residents of this village that indicate that they have a relative that has been confirmed positive, but I haven't confirmed that with a government agency.
Right, yeah, and that's something that we've heard from multiple sources, but again, because of the way they're reporting out the information about these COVID-19 positives, Mayor, we read an account from Hawaii where they had published information from I guess it's the
Hawaii Health Department,
right? So it would be the Hawaii counterpart of the Guam operation, right? So in putting out their information, they have the area the guy lives in, person lives in. They had the age, they had the travel history, the manner in which they felt,
and the gender,
and the gender. And so, what do you make of that reporting out this information? We're not really getting a lot of detail about these COVID-19 patients, and I'm not sure how much of it is hiding behind HIPAA and how much of it is maybe they just don't know. But what do you make of that type of information we're getting?
I'm like you. I mean, I have no medical background whatsoever, and so I'm not even familiar with the HIPAA laws. Typically when I have a question, if I'm not sure of the answer, I'll look. I'll actually read what the law mandates, but looking up what the mandates are regarding HIPAA is not something I really wanted to spend time doing. Yeah. And so, of course, I'm going to trust. I'm going to trust, as I should. I'm going to trust the information that comes from public health, who supposedly are the duty experts. And unless it can be proven that they're, like you guys had alluded to, that they might be hiding behind some HIPAA laws, and they actually should be providing us this information. I mean, if that can be proven, then of course,
right.
Then I have a change of.
Right. Well, we're not really alluding to it. We're saying that other jurisdictions that are reporting this same information are reporting more information. So I'm not really sure it's an illusion. I think it's just a statement of fact.
Well, I mean, I hear what you guys are saying, but by the same token, I mean, I haven't had time to research.
Right.
My focus is to be the mayor of Ortachampago. My focus is to try to answer questions as best I can. And, believe it or not, there have not been a lot of questions from residents in my village as to whether or not there have been any positive cases.
What are they asking you, though? What kind of questions are they asking?
They're asking, are these places open? Can we do this? Can we go there? Laundry, for example. Can we still go to the grocery store? Trash collection. Are they still picking up trash? I mean, those are the basic things that we would get called on anyways.
Right, and I think maybe that's because if people are doing what they're being told to do, then worrying about coming across someone who's positive shouldn't really be entering if you're sheltering in place.
Sure.
Are you guys having any sort of briefings with the governor or the Joint Information Center?
Well, we had one this week. We had one this week, and we had one last week, and so it's kind of once a week since this whole thing has been going on.
And what do they tell you guys in these briefings?
Just basically just basically where we're at in this, lockdown, and then just a generic how many cases have been diagnosed as positive, and then any plans that they're looking at as far as moving forward with how to handle the situation. And I think for the most part, and for me, it's been something that this administration has done very well. Is that they've actually gathered us together, all 18 mayors and 7 vice mayors, and not only briefed us, but more than anything, which has never been done by any previous administration, as a body, has given us an opportunity to ask questions. Because all of us kind of focus on different things based on the calls we get. And so, but they provided us a consistent forum and asking them questions directly and getting answers from them directly as far as issues that we're concerned about.
Well,
so can we give you some questions, and then maybe
Mayor.
you can ask for us?
Absolutely.
When was
the best person to give them to is the person you just called, Robert Hoffman.
He's got the pull, right?
When's the last time you guys had a briefing?
Monday.
Okay.
Monday.
And Mayor, I want to go to this lockdown because I know you're where they say, hey, Mayor Gogui, by the book. Are you going to be going around the village, doing your part to kind of enforce this order that came out that goes into effect at noon?
Well, I mean, I will do that as it applies to this village, and so, but we don't have bars and restaurants other than Homai, but yeah, I mean, we'll be kind of monitoring that. Whereas whether we'll be monitoring that as to whether or not people are doing locking down, because lockdown, according to the executive order as I read it, I mean, they can still go to the grocery stores and shop. So I've got several mom and pop stores.
Right.
I've got a laundromat, in the village, but I don't have any bars in the village.
Right.
I don't have. We have one restaurant in the village, so if I see people there, it's going to be a matter of whether they're dining in, which they cannot do.
Right.
As opposed to are they remaining open so they can try to make themselves with takeout, which they do. And they in the past even we have.
I think we've all had Homai takeout at some point or another.
Absolutely. And so, I mean, for my family, that's a very go-to thing. Call them up, and in 15 minutes we can go and pick up our meal for whatever meal we're ordering. And so, but I'm not as challenged as maybe Tamuni.
Right.
I'm not as challenged as maybe Dedido and Jigo. I mean, because I believe they have bars in their villages, and they have more restaurants, obviously, than I do.
Yeah, but what we're seeing and hearing, Mayor, is that there's a lot of self-policing, if that's what you want to call it, where people are following. I mean, I think a lot of them have been kind of following this order, and they already have been just going out to get groceries and stuff. Because when you look out, I mean, other than people going to work, and I'm not sure how that's going to change when this executive order goes into effect. I think people are afraid.
Well, I agree with you, and that's why I think the policing has been good, thus far, because people are afraid, but at the same time, what we try to do is provide them with balance, So we've been keeping our office open since last week, only as a means of letting our residents know that if they need something answered. Give us a call. Come in. If you're sick, of course, don't come in. But if you need somebody to talk to face to face, I'm there. You can sit down, talk to me, and I will answer the questions as best I can. And if I don't have the answers, I'll find out what I can based on the questions they may have.
Right, Mayor, and I think that does, in some ways, provide some sense of comfort and normalcy when we've got all these things going on around us. But maybe your residents can say, "Hey, Mayor Jesse's still working."
Yeah, and it has. I believe it has. And it has, and it does make a difference. And saying, because when we talked a couple of days ago, I said more than anything, you need to be concerned. People need to be concerned about this virus because there is no antibody that they can be administered if they catch this virus that'll help them combat this virus. And from what we've read thus far, what's been issued, more importantly, for those who have immune systems, weakened immune systems,
right,
they need to be extra careful. As a matter of fact, I mentioned I just got notice from a family, who's been a family of this village since after the war. They're what we call an ancestral family of this village, and they just had a death in the family. And so, of course, they came to borrow some canopies and chairs for their rosaries. And I said, we can't issue those canopies and chairs. In fact, and I explained to them the reason. And what concerned me is her father, who passed away, is 79 years old, and he still has a brother and a sister and other relatives that are just about his age. And so, and they, because of their age, and obviously some of them have a weakened immune system, I said, you need to, great, have your rosaries. But for the relatives in your family to have weakened immune system, you need to discourage them from attending these rosaries because you don't know who's going to be there and who they came in contact with for the last week.
Yeah, but you imagine trying to tell Tanana she cannot go, pray the rosary.
Yeah. And you hear that now. When the fact that we're not having masses, you hear those comments even now. I'm a strong Catholic. I have a bad day if I miss Mass on Sunday, for me personally. Mm-hmm. Just an emotionally bad day, because I know I had to miss Mass for whatever reason on a Sunday. And I know where they're coming from. I know where the Manamko are coming from. In fact, I'm in my 60s. So I like to think that I've earned the right to call myself a Manamko, and the point is that setting aside what the strong beliefs we have and the strong commitment we have to even our faith, ultimately we have to ask yourself is, do you want to put yourself in a position where you're potentially going to be affected by this virus, because you don't know, you just don't know that where the people that you're going to be coming in contact with might have been, who they might have been around, and whether those people that they were around was asymptomatic but nonetheless a carrier of the coronavirus. And it just can really get out of control if we loosely allow ourselves to come in contact with people on a daily basis. And then at some point in time, you may come in contact with one of these manamkos or one of these relatives that has a compromised immune system.
Or somebody who cares for a manamko.
Yeah. And you want to be the carrier or the person that they pinpoint as the carrier that infected all of these people.
Right.
Missing Mass is bad, but knowing that I was a carrier that infected a bunch of people, that's even worse. Personally.
Well, Mayor, we know you got a lot of work to do. Is there anything else here you want to share to the island, or maybe to your residents who are listening or watching the show on Facebook Live?
Yeah, stay home. If you have no reason to go out, stay home. Stay home. And if you're not sure what you can or cannot do, give your mayor's office a call. And if you need help, call your mayor's office, and if we can help, we'll try as best we can to help.
Well, there you go. Thank you, Mayor.
Thanks a lot, Mayor.
Have a good one.
All right, Mayor Jesse Gogui of Ordot Chalampago, 658. We're KUAM-FM, Agatni Guam, containing COVID. Do you want to run through the latest release that came out from JIC, just for those who are just joining us, if you want the latest numbers of COVID-19?
Oh, sure. Thanks, Jason.
Thanks, Jason.
No, this is okay.
Yeah.
All right. So as of last night, 7:15 p.m., that was the latest update from the Joint Information Center. They tested 16 individuals yesterday. 4 tested positive. That brings the total number of confirmed cases of COVID-19 on Guam to 12. And to date, a total of 81 tests were performed since March 12th.
Oh, there you go. Those are the latest numbers. We're going to take a break. We're going to do some news. We do have some questions for the COVID-19 response team, and we're told we're going to get someone on the line here at around 7:30. Facebook comments. You guys got questions about this order that's going into effect at noon. We're going to read off some of the exceptions, and we'll get to your comments next. So if you got a cool comment you want to throw out there that we can share with the audience, you do that, okay? KUAM-FM, Hagatnya, containing COVID. Good morning.
KUAM News.
Be healthy. Be informed with ITD. Be healthy. Be informed with IT.
All right, half a day, ladies and gentlemen, and my name is Andy Wheeler, and I'm broadcasting here from the I-94 FM studio. And I'm a broadcaster. I've been doing it for over 20 years, and I'm used to going into work, doing my show, broadcasting to you, giving you the information, giving you entertainment. But I have to work from home. I'm under quarantine, as many of you are, and now we're not really sure what that means, the executive order that's out. What does it mean? I don't know. But a lot of us are social distancing. We are isolating ourselves. We are staying at home. We know that much for sure. And we know the reason behind that. You've heard it a lot of times. Flattening the curve, that's the big term that we've seen growing out there. So I went ahead and had my graphics team pull a graphic from the CDC website. This is official. There, that's a graphic, easy for you to understand. You cannot argue with the science, ladies and gentlemen. That's clearly up. That is clearly moving to the right. This one, bad. that one good because the line, that's the flattening the curve. My graphics team worked really hard on this, and clearly I don't have a graphics team. I have a marker and a piece of paper. That's pretty much it. Hope that helps. Stay safe, everybody.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
the order going into effect at 12 noon, and so many people wondering how their lives are going to be affected by this order. Mm-hmm. And some of those people are cancer patients. Yeah, so we're going to bring Melissa from Island Cancer Center on. Good morning, Melissa.
Good morning.
So I know we're getting a lot of calls about cancer patients maybe going through chemo or with appointments, and how does this lockdown, the shelter-in-place order that goes into effect at noon, how does this affect services that they get from you guys?
So for us, I can't speak for chemotherapy because that's medical oncology. We do radiation oncology. Mm-hmm. And for us, even for other patients, if they have any questions about whether or not they should be going to their appointments, they can always call into their clinics or speak to their healthcare providers. They'll give them that information. For us, radiation oncology works by succession. So you need to come and meet every one of those appointments in order to get the best outcome for your cancer. So our patients will continue to come to the clinic even with the lockdown. What we've done is we've tried to limit the amount of traffic and the amount of people that they have to pass coming to our clinic. So we ask them to be delivered directly to our back door so they don't have to go through the common areas of the building that our clinic is inside. So they actually come directly into our clinic. We can measure their temperature when they come in. Patients that are new consults, we gather all the information prior to them coming. We make a pre-screening phone call to them to make sure that if they have any symptomatology that would put them as a person under investigation, then we would mask them when they come in because they still need to make their appointments. There are some cancers that just aren't going to wait for COVID-19 to be gone.
Yeah.
So how does this work? They call in advance, and then do they come in through the front or the back or?
Yeah, so our clinic is actually inside the Guam Medical Plaza. So in most cases what happens is patients would park out front, come in through the front door, and by the way, the building is screening patients when they come in also. But we want to decrease the risk to our cancer patients even more than that. So instead of coming through that front door, we're asking for their family members, whoever's bringing them to their appointment. If they're driving themselves, fine. If not, then a family member. Drive directly to the basement. We have a basement with access to our clinic, and we're the first door. Our cancer patients know where we're at. It's the first big silver door that they would see coming into that basement is the back door to the Island Cancer Center, and we've got a big sign on the door as well. So they actually enter directly to our clinic and leave directly out of our clinic, which decreases their exposure to other people.
I see.
And how hard has it been for you guys to juggle having to treat these patients with following these directives that are coming out from the governor?
Actually, not too difficult for us. Most medical places are using really good hygiene in their clinics. The personnel are using good hygiene as well. Obviously, now there's a bigger risk for healthcare workers to be exposed to somebody who doesn't realize they've got COVID-19 virus and are shedding. So, you'll see people with masks on more now when you go into the clinics, which is a safeguard for those that are treating patients. We got to keep our healthcare workers healthy so that they can continue to treat. So they'll see that there's some of those differences. Obviously, that means we're using more supplies, and supplies are in short order. So we're being careful with what we're using things for, as well as with patients.
Are you having to change your hours or anything like that?
We are speeding up our day a little bit, not a lot, but yeah, we're condensing. We don't want more than 4 people in our clinic at any one time. We can easily keep people 6 feet or more away from each other. The clinic is fairly good sized, and even in our normal everyday routine, there's generally not more people than that. The biggest difference is reducing the amount of family members who are here. So normally, we don't mind having as many family members as that patient is comfortable having. We want our patients to feel supported. Right now, that's not a good idea. So instead, we request that if there's a family member coming with you, we request it only be one. We screen them as well. Have you been anywhere around anybody that's possibly been off island in the last 14 days? Are you experiencing a cough, cold, sore throat, any of those respiratory symptoms? We ask all those questions to those people as well. And in general, the public gets it. They understand. They're not pushing back on that. More often than not, what we're seeing is they're just dropping their family member at the door. They're staying in their car and waiting until they need to pick up their.
Very good to hear. Well, Melissa, thank you for checking in. I know you guys got a lot of stuff to do to just kind of prepare for this order, so we really appreciate it. And any thing you need to get us out or you need us to get out, don't hesitate to call, okay?
All right, I certainly will. Thank you all so much for what you're doing to help spread the good word out there.
Thank you very much.
also for what you're doing.
All right, 7:15. That's Melissa Weibel Island Cancer Center. Hey, let's go over this order again. It goes into effect at noon. Executive Order 2020-05. There's a big chunk of this here is on social isolation, a prohibition. This is Section 1 of the order. Prohibition on gatherings and mandatory social isolation. They cite Guam law, and it goes on to say all public gatherings or congregations for purposes of public entertainment, recreation, food and beverage service, theaters, bowling, fitness, and other similar activities to include all public venues in which the serving, provision, or consumption of prepared food or beverages occurs at a table, bar, or for consumption are prohibited, beginning at 12 noon today. There's also a lot of exceptions.
Right, there are. And just to put it real simply, healthcare clinics, they're exempt, dental clinics, hotels, restaurants, but it's only takeout, drive-through only. And the media.
Yeah, and media, we got a nice exception.
Laundromats, dry
Right.
cleaners.
So one of the mayors that we were kind of thinking about, and she got a name drop from Mayor Jesse Gogu, was Mayor Louise Rivera, and presiding over a village like Tamuning with so many businesses, so many restaurants. There are going to be a lot of people with this order, and people knowing that they can only get takeout or delivery, more so the takeout. There's going to be a lot of people going into Tamuning, so I'm wondering how is she going to manage, and how at the enforcement end with the Guam Police Department are we going to kind of manage this 50 or less, and then on top of that, just the general order that you should be staying home.
Right. We actually, I just messaged her to have her call in. She should be calling in shortly.
Right.
Unless we can call her. You able to call her? No?
Yeah, I can.
He's gonna do a stretch.
I think I can handle calling somebody. I know I'm a little rusty, but.
So yeah, we're going to be calling, hopefully getting on the line, Tamuning Mayor Luis Rivera to talk about. Thank you. To talk about the lockdown that's going into effect at 12 noon today. There are several exceptions, as we just mentioned: healthcare clinics, dental clinics, laundromats. Takeout is only allowed now. Fitness facilities closed, and other areas. All the complete list, you can find it right now on KUAM.com or on our app or our Facebook page.
All right, so let's try Mayor Louise Rivera on the show. Mayor, good morning.
Hafaday, good morning.
Hafaday. So how are you doing?
Okay, we're hanging in there and still doing what we can to help.
Mm-hmm. How are you preparing? How are you preparing for this lockdown?
Well, for the lockdown with our staff at the mayor's office, we still have been actively out there cleaning, cutting grass, passing out food to the seniors, stuff like that, and sanitizing the area, keeping people informed. We're still taking calls coming in requesting for verification of residencies, letting know that we will email it to the appropriate authorities, the appropriate agencies, and so we're still we're on duty from 8 to 5.
Okay.
Mayor, we're anticipating a lot of, hopefully not too much traffic, but what are you kind of doing to enforce this shelter-in-place order and, all the new rules that have come out and are going into effect at noon?
Well, there have been a lot of inquiries since that executive order came out, and I'm really glad the administration came back and clarified it, was more specific and detailed into what businesses can remain open. The main thing is to stop congregation. So, even if businesses, like the financial institutions, not only the banks, but, there's also personal finance center and, other agencies where they can make appointments, but of course use the protective gear so they're still able to assist the residents of Guam, and, in their time of need.
What are your residents saying, Mayor?
Well, there was a lot of concern about how the place of quarantine is in a very busy road, a residential area. So right away when we found out about it, I called Homeland Security to see how they are going to quarantine these people to make sure that that they're safe and away from also infecting others.
Mayor, did they tell you that they were going to put a big quarantine facility in your village?
No, they did not, and that's why, like I said, because people have come in before the mandatory quarantine. People have come from off island, so they have taken it upon themselves to stay quarantined in a hotel, and not worry, so they don't worry about infecting others at home that have children and other family members. So it just so happened that one of them had given me their letter saying they need to clear out and they're going to be moved to the sister hotel in 2 months. So, it was shocking for some, because they were, they have been staying there comfortably, and all of a sudden they have to get up and hurry up and get out because a morning flight is coming in.
Right.
So there's always a lot of emotions and concern, and especially how they talk about the vulnerability of the seniors and children. And then now they're finding out it's middle-aged people too.
Mm-hmm.
Yeah, I read it. I'm 45 years old. I think, am I 45? Yeah, I'm 40. Yeah, I'm 45 years old.
I stopped counting.
I haven't celebrated my birthday in like 5 years. But I just read a story coming into work, a national story about, middle-aged people are now being hit hard by this COVID-19. And I mean, very unnerving. Nationally, there was a 40% spike in the number of confirmed cases. And I think if we had the test to test more people, I'm not sure where our numbers would be. And that's what, people are saying. It's funny, Mayor, you read these comments, people are like, why can't we do like this country? Or why can't we do well, we're not a country, first of all. So
I did want to ask, you said that you weren't aware that they were going to put these quarantine facilities in Tamuning. Have you had any communication with the Joint Information Center, Adelup, the governor, anyone, to inform you whether or not there were any confirmed cases in your village or from your village?
No, that I did pose that question. I asked that we be informed at least of what villages they're in, the way that they had identified the villages when we had the dengue fever. Because many residents are concerned about that. They want to know where to stay away from. I mean, because, there's a lot of people that have come in from off island that, that have gone, gone to different functions and places. And so, we really don't know. And that was one of the questions I'm waiting for an answer for. They did pose that question to the public health representative. We still haven't had word from him.
When was that posed? On Monday during the briefing?
No, it was again last night. So the people over at Homeland Security have been very good about responding back to me, but they're just telling me that they haven't had word yet, to identify the villages.
Yeah, and I think that's what a lot of people are kind of waiting to hear because, like you said, this is something they did with the dengue outbreak.
Right.
Yeah.
Did you have daily briefings on the dengue outbreak, or?
No, we have not been having daily briefings. With me, I have been every time I receive something from the Joint Information Center, I send it out right away to all our neighborhood chats. We also have a social chat. If anybody else is interested in being a part of it, they can give me a call our office. We do have our staff all standing by to answer phones.
Right. Mayor, I got to ask you, nobody is talking about the homeless. What about the homeless people? in Tamuning, what are we doing with the homeless? Are they just going to stay on the streets? Are we putting them in a shelter? Has anybody even thought about this?
It has been brought up to our meetings, and you know, the basic thing is, and you know, when I talk to the homeless around our office compound, our park, you know, I just I let them know to, you know, do what they can to sanitize, or if they have family members that they can go to. Them had said that they were going with their cousins.
I'm sorry, they were what?
No, well, the ones that I did talk to had told me that their family members were picking them up.
Okay.
And, you know, I told them to stay their distance and continue to clean up and practice good hygiene.
But in terms of like having the briefings that you guys have had, well, I guess one since Monday, the issue of how to take care of homeless people was ever brought up? Was it ever brought up?
It was brought up, but we didn't get a definite answer.
So there was no plan.
Right.
Okay, Mayor. Well, you know, keep us posted. At 7:26, we got to take a break. We're going to be hearing from Adeloop in just a few minutes, and we got a lot of questions that we want to ask them to get it out for the people. Are you're good, Mayor? Then.
Yes, thank you.
Okay.
Take care.
All right, Mayor Luis Rivera. Of course. What is it? What do they call it? Tatuha. Tamuning, Tumon, and Harmon. All right. So it's 7:26. Hey, we got to take a break. There's nothing wrong with your radio. It's pretty all right. It's the KUAM News COVID-19 takeover. Good morning to our Facebook listeners. When we come back from this break, we're going to read off some of the comments.
That's what you said.
I know.
Before.
I'm just, you know,
Come
a lot going on. And find out what you guys thought about the governor's special address right here on Guam's favorite I-94. Good morning.
Off today, a lot of people are talking
Be
about
healthy.
coronavirus or
Be informed with
COVID-19.
ITD. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
It's the Gateway of News takeover.
Half a day, everybody.
Good morning. So we know it's very busy. Let's go ahead and get the Adelute Press Secretary, Crystal Apaco, on the show. Morning, Crystal.
Morning, Chris.
So I guess just first of all, have we got any info on the travel history of these latest 4 positives?
Actually, all of them.
Or the last, I guess, 7, right?
I understand everyone wants more information on these additional cases, and I'm working aggressively to get more information. The last thing I want to do is release bad information, the way we did our first press conference. You know, we told everybody that the traveler was on a flight on March 2nd, only to have to retract that statement after further investigation showed us that the traveler actually flew in on February 29th, on that leap day. So we want to make sure that the information we're putting out is correct. I don't have any further information. I'm going to work on that. My first priority is for today. I know the people of Guam deserve to know, and I know as a former member of the media that's a priority that you guys want to put out there.
Do you guys have response activity coordinators, though? I mean, aren't they supposed to be working on getting information so that the Joint Information Center, whoever the lead person is supposed to be getting out that information to the community?
Most definitely. We do have RACS response activity coordinators, as you're talking about. That Emergency Operations Center is activated. I work with them closely. As you know, the JIC is located right next door to the Emergency Operations Center. But the information that I am putting out in my press releases on a nightly basis, I'm getting that straight from the lab.
You're getting what? I'm sorry, you're breaking up. What?
I'm getting that straight from the lab. And so all this information, the RACs find out when I find out.
Okay. Crystal, we wanted to ask, when you read national reports, that come out from, bodies that are similar to the JIC and what you guys are doing, there's a lot of information in there, their age, gender, detailed travel history. Where's the blockage coming from? Because and is it just a policy for you guys to release this little information about these cases? Because we're seeing the precedent. I mean, in our neighbors in Hawaii, the media there, the releases that are coming out from HHS in Hawaii, there's just way more information. And I feel like the sticking point for us is that we want to make sure that the people listening out there, being the biggest media outlet on Guam, that we're faithful to the people who listen, that we give them the best information, or any information for that matter.
Understood. And it's not a policy blockage. It's that we really are vetting the information. Like I said, that first press conference, we told the people of Guam the wrong travel date.
Right.
And so people on the March 2nd flight were unnecessarily panicking.
Right, but I mean, if you guys put out the wrong information, I don't think that the people of Guam should have to live in a vacuum while we wait for you guys to figure things out. I mean, to be fair.
Again, Chris, this is my number one priority for the day, getting the list, putting out that information. Again, I'm not going to say the exact age, but maybe someone in their 60s, someone in their 30s, male, female, travel history, where to. And so as we've already previously noted, the confirmed cases, the ones with travel history did travel to the Philippines. And that is why we have the stronger mandatory quarantine protocols for individuals arriving from the Philippines.
Right. Where are we on the test kits? We haven't been able to get a straight answer out of you guys. We spoke to a couple senators. They said the governor had told them less than 200. Obviously, we've tested a lot of people. So if you could provide us, is there an accurate number as of at this moment?
Can we start, though? How many test kits arrived? How many test kits did we have?
So I understand is that, when the box of the test kits arrive, it's not a set number because it's an approximate number. It's approximately you can test as many people. I have to speak to our epidemiologists and our lab guys about what that exact number is. But I was assured that we have enough test kits at this point. We've made ask from the CDC, and we are going to receive more test kits shortly, very, very soon.
What's the approximate number that you guys received?
I can't say at this time, but I can also tell you that our public health director, Linda Pinco Tenorsi, she just signed, I believe it was yesterday, a contract with DLS so that we can send more of our test samples off island. We can send them to Hawaii. We can send them to California. So we are exploring all our options. We've also had some of the doctors here present to us options for purchasing additional test kits. As you know, the CDC has broadened their criteria. Not broadened their criteria, but they've allowed us to use WHO certified test kits, not just CDC or FDA approved. So, as you know, people in the region are able to do their own tests, and how come we're not able to do that? So now they're allowing us to do that, and so we're exploring our options. Maybe we need to buy another machine. Maybe we need to buy more test kits from another place. So we're actively seeking that out. But I can tell you that as of yesterday, on Denorsi, she signed a contract with DLS, so we can send more of our samples off island.
But you're still not telling us how many test kits we have. We're hearing that it's under 200, and is that affecting the response here? Because if you look at other jurisdictions, and I know we're not other jurisdictions, but how they're kind of turning the corner on COVID-19 is by testing a lot of people, and we just simply don't have that capability right now, right?
Well, we're building our capacity every day, not just with test kits, but our doctors and our healthcare providers. Earlier this week we added almost 50 nurses we activated almost 50 nurses, and they're helping with our community health centers. They're helping at the airport. They're helping at the hospital.
School nurses, right? School nurses?
School nurses,
yeah.
Yes, school nurses. And so we've also added, as you heard last night, we've added Dr. Mike Cruz as our state surgeon, Dr. Jolene Uggan. She is a pulmonologist. Her specialty is respiratory diseases or respiratory disorders. And so we're building our capacity every day. This is an unprecedented event.
Okay, you said enough test kits. What is enough? How do you determine what is enough?
I can tell you we'll make it through the next few days comfortably.
Why can't you give us a number, though, like a ballpark? Do we have 150? I don't understand. We asked Carlo. We got, run around the island from Carlo. We're not getting anything from you. I just think people are maybe you don't want to release a number because you feel like it's going to cause anxiety maybe, or we don't understand why that information is.
Because I honestly don't know the number, but I have been assured that we have enough to get through until we get our additional test kits. And I can tell you that's coming very soon.
So we're comfortable for the next several days with the test kits that we currently have.
I feel comfortable saying that, yes.
You feel comfortable saying it, but...
Also, I've been assured from public health.
Okay.
What's going on today? What's the plan for today? Have we already received any samples from any of the clinics, or what are we doing as far as testing? You have anything on that?
I don't have any updates. I didn't get my brief yet. You know that my brief is usually at 7:30 in the morning. It got pushed back a little bit for today. Every day it's a new day, and we have to take guidance. We wake up and it's new news.
What about the status of the skilled nursing unit?
It opened late yesterday afternoon. I understand that we received our first COVID isolation patient there. So this person was transported straight from GMH to the skilled nursing facility.
So everybody that's at GMH, the isolation unit there, they're all going to be transferred up to SNU?
I believe we have separate staff, and we have separate staff for COVID ISO. That's COVID isolation. That's what we're calling the SNU at this point.
Crystal, so the SNU, has the entire SNU been fully converted to be able to handle these COVID-19 patients, or did we do a partial opening?
At this point, I believe it's just a partial opening. I believe 2 of the 3 wings are ready for patients.
How many
Per my
people?
last briefing.
Okay, so how many people are at the ISO unit at GMH?
I haven't got briefed on that this morning. If I can get back to you.
Okay, how many were there yesterday?
I stepped out of the meeting at that point so I could write your press release on the confirmed cases.
Yeah, that's the problem, is that if you step out of a meeting and then we don't get information, I just feel like there's a gap.
But you also want the confirmed cases, so.
Well, we want it all, Crystal. We don't want to have to pick and choose what we want based on how available you are to attend a meeting. I mean, it's pretty simple.
Understood. And I want to make sure that I'm putting out accurate information. As you know, misinformation can spread just as fast as the virus itself.
Right.
All right, so how many are you aware of from the last briefing that you can recall were at the ISO unit?
At the last briefing, I could say that.
Did you remember?
At least 3, and those were the 3 confirmed cases from earlier.
Okay, and so
in the GMH ISO.
So out of the 8, or we're at 12 confirmed cases, how many are at GMH?
I have to follow up on that.
Crystal, while we're on GMH, so there was a video voice note going around, and you guys had previously discounted other similar types of unverified messages that were going around. This was a video about, I'm sure you saw it, this whole
I sent it to her yesterday.
GMH is infected or whatever. Why wasn't there?
Was that the one with the Snapchat filter?
Yeah,
that one, and then the audio, the 2 audio files.
So were they the same audio?
Yes.
Yeah.
Okay. So we're working to address that. I called Lillian yesterday. Lillian Posadas, our GMH administrator, and I got on the phone with her trying to understand what the situation is.
So is there a situation at GMH and where any of the staff there were exposed to the coronavirus, where any protocol was broken?
I'm not tracking that. So I'll work to get more clarity this morning, along with more information on our passengers or our confirmed cases at this point.
So you haven't heard at all if there were any health care professionals at the Guam Memorial Hospital caring for COVID-19 patients that were exposed to the virus or quarantined or anything?
Or tested positive?
Nothing I'm tracking.
What about if you could verify or provide any more insight, is that we had tips that there was an employee of Civil Defense that may have been exposed to somebody who also tested positive, and we're hearing this from staff at Civil Defense. So we're not sure about that, if there's any verification we get on that.
That's worrisome because, as you know, I spent all of my day, my 16-plus hour workday at Civil Defense, but I don't know of anybody that's been tested in my surroundings.
So that's not verified?
That's not verified.
Okay, so.
What about the status of the COVID-19 patients? Are you able to give us anything on how they're doing, generally speaking?
Generally speaking, I can't tell you the last 4, but last night's 4, I haven't got any updates on them, but I can tell you they all remain in isolation, and that's all I know at this point. I'm so sorry, Chris, and I'm so sorry, Bree. And as you know, I know what it's like to be on the other side, wanting more information, and I'm feeding as much information as I can get out of that properly.
It's just simply not. I mean,
are you the only one working on getting this information out? Do you have a communications director that also works with you? Or
yes, I have a communications director. We have an activated JIC. That's the Joint Information Center. It's Homeland Security, we have Public Health, we have DOE, we have the airport, Customs, GPD.
That's what I'm saying. If you have all these people, then why are the information is not matching the number of people. And Crystal, again, it's just very frustrating for us because all we're trying to do, we're not trying to hassle you, not trying to pull you out of meetings.
Yeah, we're
trying to make sure that people know that what's going on, that they have the information, and really, it's just I can't wrap my mind around it. I understand it's a new administration. There's probably some growing pains, but really our intent is not to fluster you or anything. It's just really the main motive is to get the information out to the people, and it's just simply not happening. And I'm just not. I don't hear good enough justification. I think we need to do better.
And I'm glad for the feedback, and I'm working every day, and our team is working every day to get better. As I said before, this is an ever-evolving situation. It's unprecedented, and every morning we have to change our game plan because the other day we woke up and we knew we were going to get an influx of passengers coming from the Philippines. So we had to change. We had to we had to adapt to the changing situation. Yesterday, as you know, the governor signed Executive Order 2020-05 for social isolation directive. And this is just another step in our protective measures to protect the people of Guam.
Why haven't we seen the governor, other than a special address, just as kind of by comparison? I'm not saying she's President Trump, but, President Trump, governors of other jurisdictions are presenting themselves to the public in an atmosphere where the media can ask questions and have those questions answered. We haven't had that opportunity since Sunday. I know it's a crazy week, but we're just kind of wondering, but more so than us, the people are wondering.
Of course. And I can tell you I had a press conference scheduled yesterday, and that we had to change that plan because we decided we had to adapt. And that's why you saw the social isolation directive guidance.
Yeah, we got that from the legislature. We didn't get that from Adelup until 3-4 hours later.
I was sharing it.
With who? It wasn't the media.
I was working on the FAQs because we were bombarded with questions, Bree. And I wanted to make sure there was clarity before we sent it out. Unfortunately, the legislature may have sent it out faster than we could, but we wanted to make sure that there was clarity.
Well, I think the legislature sent it out because they got it, and it was some major information that people needed to know. I think that's why they sent it out.
And it prompted a lot more questions.
Sure.
And so that is why we issued the guidance shortly after. And so, unfortunately, they were able to push out the executive order signing before I was able to answer all the questions and give that guidance. So we were bombarded at the Joint Information Center with all the questions. Can I have a funeral? Can I have a drive-through? Do the hotels have to close? Does my fitness center have to close? Does my bakery have to close? And so we are working actively. You saw the guidance, about 2 pages.
Yeah, so the FAQs, you didn't have the FAQs ready before sending out the executive order, not anticipating that you would have this flurry of questions.
Most definitely, and that could have been improved. We could have definitely improved our processes in that point.
It kind of seems like you need some help.
Yeah.
I mean, if you can't sit in meetings and you can't, who's managing the JIC? Traditionally the communications director, right?
We have Carlo Branch also with us, and we're a very stable team. Thank you.
Anything else, Bree?
I'm kind of just, I do have something else. There's this video that is circulating, or actually it's not even circulating. It's up on the World Wide Web. There was a promotion, I understand. It was of the governor and lieutenant governor. Excuse me?
Again, it's being pulled down.
Mm-hmm.
I spoke with GVB this morning. It was an oversight on our part. We didn't pull it down. Again, we expected to pull it down once we had confirmed cases, and that didn't happen. A lot of moving parts, Bree and Chris, and I know you understand it's crazy, and we're adapting every day.
Well, the people don't want to hear that it's crazy from the people who are in charge. So,
well, it's crazy in the sense that we're having to, every morning we get new guidance. CDC, broadens their guidance, or Trump will say, okay, 50, now 10. And so
let's ask you about that.
I wanted to go back, to this video. Okay. When was this video posted?
This video was posted over a month ago, I want to say.
In
and
February.
That was specific to the markets.
Right,
so whose idea was it then that let's promote the fact that Guam is coronavirus free in the middle of a crisis?
That was prior to any of our confirmed cases, Bree.
There were
doesn't matter.
Coronavirus was confirmed in other jurisdictions that we were marketing to, I think is the point.
And where was this? This was, what language was this? Korean? Japanese?
I saw only the screenshot of it. That might have been an Asian market. I'm not sure which one.
Is this the only video to this particular Asian market, or was it sent to Japan?
It's being pulled off all our markets.
Okay. Let's going back to what you said about President Trump's directive. I'm pretty sure it's almost a moot point now that the social isolation order has come down. But are we doing any downward adjustment to 10 people or anything like that?
No, again, just keep it under 50. Our threshold remains 50, but again, the social isolation directive will cover that. Basically, closing any places with congregations or any areas with congregations.
Right. Yeah.
Just you know what I mean. Closing down any congregating areas. I think I saw pictures of McDonald's, and they had signs, and they're basically saying our dining room is closed, but you can do takeout. You can do the drive-through.
Can you give us any more info on the trace investigation, going back to Sunday when you guys erroneously announced the flight information and later corrected it? How has Public Health's trace investigation? We're able to kind of just put some things together in talking to a couple of mayors this morning, but we know that you have access, so we kind of want to know where we are on that.
Again, several individuals have been identified as potential close contacts, and so they are being interviewed. And if a test is warranted, then that will happen.
And, the mayors, they are asking some sort of more transparency from the Joint Information Center from Adelup in terms of whether their villages, whether there are any residents that have tested positive from their villages. Why can't they get that information?
I wasn't even aware that. I thought I was talking that they were updated. We can do a better job at updating our mayor.
Yeah, none of them were updated, actually.
Okay, noted.
Okay. So again, are we going to be able to get that information? Because they said basically Mayor Hoffman, Mayor Gogui, and Mayor Louise, also Mayor Melissa, had said that during the dengue outbreak, you guys didn't have a problem telling them what villages were affected. So I guess, in their mind, they're kind of wondering, well, why doesn't the same logic apply to COVID-19, which is obviously a pandemic level threat?
And then that was why one of our first steps was closing our senior centers, because they're the most vulnerable population, so let's protect them first, and then shortly after, the school closures happen. So
why haven't we told the mayors if they have COVID-19 positive patients in the villages?
Well, we can definitely work on our communication then. Thanks, Chris.
Sabrina?
So you guys plan to let them know?
I would have hoped, I believe that they were contacted, but I guess not. And thank you for bringing that to my attention. We can definitely.
Are you going to include those in the press releases too?
And that's the first thing I will get to after I get off the phone with you, is gathering more information about all the confirmed cases.
I feel like we need to let you get off the phone so you can go gather information.
Yes, sir.
Okay. So anything else you want to ask, Bree?
I probably won't get an answer, but is there anything you'd like to say? Crystal.
I'm thinking there's so much I want to say. Again, the situation continues to evolve. I want just people to stay home at this point. That's what the governor really wants. People to stay home. Let's stop the spread of COVID-19. Stay home. Limit your exposure. If you have to go out, go to the grocery store and come back home. What I've been hearing about is businesses limiting the amount of people that come in, and even the people that are waiting outside in line, they're practicing social distancing. We can't emphasize that enough. And if you're sick, stay home. If you're going to cough or sneeze, even if you're not sick, sometimes they cough or sneeze. Cough and sneeze into your arm. Don't touch your face. Wash your hands regularly. I know it's basic. I know it's not sexy, but wash your hands regularly.
It's actually pretty sexy to wash your hands. Yeah. Hey, Crystal, sorry to interrupt, but just real quick, are we concerned about the governor's health? She is at that age where she is one of the vulnerable members. Is that maybe why we haven't seen? Is she doing self-quarantine? Is there anything you could tell us about that?
She's not doing self-quarantine, and we just want to make sure that she gets enough rest as well. I think all of us are a little sleep-deprived, working like 20-hour work days. So as long as she keeps her rest, I'm sure our Magahaga will be fine.
Have you gotten any feedback on how the mandatory quarantine protocols and processes have been going? Because we've been getting phone calls. We've probably even seen the pictures on social media that, they're calling it unorganized, and people there are concerned. About they come in and some of them have done self-isolation, and then they're mixed in with all these people at the terminal, shuttled onto buses, and then go to the quarantine approved facilities, and people aren't wearing protective equipment, and they're really concerned that they may not have had the COVID virus.
You didn't have
coming
COVID-19
in,
before.
but now there's a strong possibility that they might.
And as you can imagine, the first day of a rollout, there will be hiccups. I can assure you that many of those hiccups have been addressed today.
All right.
Well, you can assure that they've been addressed today. Okay.
The ones that I'm aware of, yes.
Okay, Crystal.
Thanks, Chris.
Okay, we'll see you.
Thank you.
There you go. Adelup Press Secretary Crystal Paco, 7:54. We're going to get Major Joe Blas on the show. Okay, let's just unpack that, Sabrina. Very, very. It's yeah. I mean, I don't even know where to start. I think we should take a break
Yeah,
and kind of
I think so
regroup.
too. I need to.
I think Bree needs to do some deep
I need to
breathing.
go breathe.
Hey, Facebook comments, questions, concerns, 637-0094. It's the COVID-19 takeover on Guam's favorite. Good morning.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
All right, half a day, ladies and gentlemen, and my name is Andy Wheeler, and I'm broadcasting here from the I-94 FM studio. And I'm a broadcaster. I've been doing it for over 20 years, and I'm used to going into work, doing my show, broadcasting to you, giving you the information, giving you entertainment. But I have to work from home. I'm under quarantine, as many of you are, and now we're not really sure what that means, the executive order that's out. What does it mean? I don't know. But a lot of us are social distancing. We are isolating ourselves. We are staying at home. We know that much for sure. And we know the reason behind that. You've heard it a lot of times. Flattening the curve. That's the big term that we've seen growing out there. So I went ahead and had my graphics team pull a graphic from the CDC website. This is official. There. That's a graphic. Easy for you to understand. You cannot argue with the science, ladies and gentlemen. That's clearly up. That is clearly moving to the right. This one, bad. That one, good, because the line, that's the flattening the curve. My graphics team worked really hard on this, and clearly I don't have a graphics team. I have a marker and a piece of paper. That's pretty much it. Hope that helps. Stay safe, everybody.
Be healthy. Be informed with ITD. healthy. Be informed.
Before we kind of get to unpacking that interview, I think we have Dr. Akimoto on the line. Doc, are you there? Okay, he's not. So that's good because I really wanted to just unpack the interview.
Go ahead, unpack.
We had a lot of comments on Facebook. Do you have any of those up, Bree?
Oh, you sure you want me to read them?
Yeah, I think it was very.
Any of you guys want to come up and read them? You probably.
Yeah, Jay is. So hey, we're doing the Facebook live stream. Thanks for watching. We still got we're gonna bring on.
I can read some of the comments.
The crayon lady is coming on later. I'm sorry.
We got
we have a poll.
Yeah, we have a poll, guys. You can do it on Twitter. I think it's also up on the Facebook.
Mm-hmm.
How ready is your household for quarantine and social isolation?
28%, I'm ready. 44%, somewhat ready. 28%, not ready.
What are you, Bree? Just be honest.
Somewhat ready.
Right, yeah.
Somewhat ready. We've been here working and, so I'm somewhat ready.
How many hour days have you been working? 20 or 16?
All right, let's get to some of these comments.
Yeah, okay.
All right, let's see. I don't even know where to start. Okay. Richard Santos, I probably shouldn't. It's a FUC matter of life and death. Get to the point. What's FUC?
It's a bad word leaving out.
Okay. I didn't know if it was an acronym or something.
I got you, yeah.
Julie, Tony, Cruz, Baza, True, Busta, Di Melania is basic the saying Gifinu Chamorro. Yeah, I'm not going
Which
to.
is basically saying the same thing.
Yeah.
Right.
Chester Soriano, they will not share information. They are just keeping it to themselves. They are just protecting themselves, not the people of Guam. Richard Santos, no one knows anything. They lie, so we could be assured everything is okay. Jason Joseph, yeah, keep it to theirself and their family.
I like this one. LOL, Chris, they need help.
Yeah. Susan Leon Guerrero, 2 pages and still no truth in her answers. Do we really have to keep going?
Okay.
I
So
don't think we have
let's
to
go to
keep going.
Dr. Akimoto here. Doc, good morning, Doc.
Good morning, Chris. How are you?
Good. So we haven't spoke to you.
Couple days.
Yeah, it's been a few days. Can you just tell us?
Honestly, I think it was yesterday, buddy. You guys
Oh.
have just been living this nonstop. No, I think I just spoke to you like 12 hours ago. You guys have been living this, and we need to applaud your whole team because it's an incredible amount of information and coverage, and I'm pretty sure it's starting to feel overwhelming. But no, I just spoke to you like 12 hours ago.
Oh, that was you.
Sorry.
Okay. Right. You know, all you doctors sound the same. So, Dr. Vince, what's going on? Just give us your situation.
Well, as you know, there's more cases even just in the last 24 hours, and I just got off the phone with Dr. Wen. he was running our urgent care clinic last night. So throughout the whole day, we saw over 150 patients through our system. We tested many patients, and at least one of the patients that I swabbed is almost a guarantee positive, and he says he thinks there's at least 3 others. So our clinic is seeing a tremendous amount of people who either have traveled within the last 2 or 3 weeks where they may have been exposed, or they've been encountering people that may have been exposed or have been found to be positive, and so they're at risk, and so they're coming to our clinic for testing. And so American Medical Center is now the epicenter of testing on Guam, but we are very frustrated with public health. The message today is that the public health, Guam public health has failed. This call is a vote of no confidence in the physicians who are mismanaging the Guam public health system. They have continuously blocked our ability to test rapidly. They've delayed the results coming back so that we can tell patients whether they're negative or positive. I don't have to ask their permission to do an HIV test, a diabetes test, or a syphilis test, and these or when I run tests for a heart attack or a stroke. So they're defeating our ability to treat this disease and contain it, and I'm calling for the governor to remove Dr. Maglonia and Dr. Poblitsky immediately. We have many other doctors on Guam who can do a better job, and they need to leave because they've hurt our island. We have the greatest number of people testing positive per testing. I think it's something like 16 tests yesterday. 4 were run and 4 were positive. That's the highest in the nation. We lead the United States now in, I guess, what you would call penetrance or maybe accuracy. We don't apparently waste a lot of tests here. We have to make sure you're absolutely likely to be positive before we'll run the test.
And that's going to lead to a higher percentage, right, Doc?
That means people are spreading the disease because we know a lot of people are asymptomatic. And the thing is, when people tell you that they might have been exposed, you might want to believe them if they have a cough and a fever. You know, why are we getting in these arguments? People are afraid. They're panicking. They're coming into our clinic to ask to be tested. I'm going to test them. And we're finding now that we have one of the largest penetrants of positive tests in the nation. And we believe that most of these people are going to survive. They're going to do just fine, particularly if they stay outside, get some exercise, and get a lot of rest. You know, if you're going to be in lockdown or whatever we're calling it this today, it's not a miserable situation if you're going to survive this epidemic, and we're going to kill it. We're going to keep the virus from finding new hosts, and it's going to die out because Guam is good.
Doc, I got to ask you, because it kind of seems, and I've heard this from other doctors, people want to get tested, they can't get tested. Is it because we don't have enough tests?
No, absolutely not, because apparently we still have about 75 left. You know, after receiving the test last week, we still have about 75 left, despite the fact that we just ran 16 tests yesterday. I mean, we're running 10 to 16 tests a day. Apparently, there's quite a number of people quarantined in hotels around the island. If we would test those people, we'd find out whether they were positive or negative. Sorry if I'm kind of racing. I'm going to slow it down. This is not panic. This is anger. I'm not afraid. I'm very mad that our public health system, particularly Dr. Maglonia and Dr. Ann Poblitsky, have not worked with this community of physicians who are on the front lines. They've defeated us. We don't need them, and there are other doctors that are willing to step up and need to step up. I'm calling on Dr. Mike Cruz as the czar of COVID-19 test. This whole effort to replace these people, and we will move on functionally because we have people that know what to do. The people in the lab know how to do this, and it's amazing what Mr. Malari was able to do in such a short period of time. He is one of the heroes of Guam. I bet that guy hasn't slept much. In the last 7 days, he's run 81 tests, and I don't quite know. 16 of them are positive. So he's run 81 tests, 16 of them are positive. That's probably a world record. We are leading the United States and perhaps the world on this day in terms of the greatest number of positive tests per person tested. And it's all statistics. It's all science. Who cares? Coronavirus is here. It's probably not going to kill you, But if we have it spreading, we need to know where it is. That's what public health is supposed to do. And, besides that unpleasant bit of advice that we're giving to the government of Guam, which is to remove Dr. Jana Manglonia and Dr. Aaron Pulvitsky and replace them with competent people, we will persevere. We need to move on. This is just like a football game or a basketball game. Sometimes you have to substitute some people. It's unfortunate, but that's what we're doing now. It doesn't mean that this fight is over or that we're going to lose. Yesterday, we took care of 150 people in the American Medical Center system, and they did just fine. The American Medical Center is open today, and we will continue to see people. The emergency room is open today. Both hospitals are fully functional. We're going to be just fine.
Doc, there was some talk this week about those on the front lines, healthcare professionals, doctors, nurses, possibly being exposed or quarantined. Can you tell us anything at all about that? We weren't able to get anything.
We're all being exposed, Chris. I mean, when you go to Kmart, you're exposed. When you go to work, I mean, all these media folks that are walking up to people, they're exposed. You're gonna evolve, or you're gonna die. And my money's on you evolving. You're gonna adapt. You're gonna kill this virus. Your immune system's gonna do just fine. There are some people, unfortunately, that don't stand a chance, but hopefully you're not one of them. So I'm really glad you quit smoking, by the way.
Thanks, Doc.
I did want to ask a question just for clarification. When you say that you took tests, can you explain what you mean by that, and then how it goes to public health?
So we are donning that full protective gear that you see on TV. I mean, it looks like, what is that, Contagion? The patients get to see me then looking like a monster or some sort of astronaut, and it literally is an out-of-world experience because I can barely see them because, there's steam fogging up my mask. But the test is really simple. It's just a really small little swab, almost like a Q-tip, but very, very expensive. I think it's like $1,000 a pop.
Wow.
And we collect the mucus on both nostrils. It's not pleasant. Mr. Trump had it done to himself, and he complained about it. But
yeah, it's a little sharp at the top.
No, it's not. Don't be a baby. It's really soft. And, that's the thing. The guys always think they're going to die, but the women, it's nothing. I think it's more tough to pick out nose hair than this. And then we do it. It takes very little time. It takes more time to take off all the equipment. And then so every time we do it, it's like surgery because we have to we gown up sterilely, and then we have to degown very carefully because stuff splatters on us, and we're not taking any chances because I expect to go home to my kids, right? So I'm me, my nurses, my whole staff. Every day we're exposed to potentially a lot of coronavirus. And so far, I don't want to jinx myself, but I'm doing just fine. And there have been other doctors and nurses that have been exposed, and some of them have gotten very sick, but they've recovered. And so we plan to do the same. And supposedly, I will be immune, and I will never need to worry about coronavirus for the rest of my life if my immune system evolves, and I fully expect it to. So that's why I'm actually talking to you from the beach here in East Agana, looking at Alupang Island, and it's actually a beautiful day. And I'm taking my own advice. I'm coming down here to kill coronavirus, and guess what? There is no coronavirus on the beach here on Guam. So,
well, thanks, Doc.
So you take the swab. I can't even say it.
Schwab.
So you take the swab, and then you call public health, and they come pick it up, and then they decide which one.
They don't come. No, they don't come and pick it up. One time or twice, the lab director came and picked it up, and I said, "What are you doing here? You're supposed to be running the test.
Right.
You're supposed to be running the lab. There's only 3 people in the public health lab, and I'm going to tell you, all of them are saints. All of them have been abused by multiple people on the phone and in person. I mean, they're just doing their job, so please quit yelling at them. Those folks in the emergency room, they're doing their job. Let's not be, cute about this. It's their bosses. Their bosses tried their best, and they failed. We are now the most infected island on the planet. Public health has failed. The leadership failed. They'll be replaced, hopefully, by the end of this show, and we'll move on because, there's no victory in somebody else's failure. We need to get through this, and we're going to get through this, and hopefully nobody dies. We don't need to talk about death. We'll talk about life, and we're going to evolve. We're going to defeat this virus.
Doc, thank you so much for your 2 cents there. Really appreciate it. And thank you.
That was more like a $500.
Yeah, it was. I could probably buy some test kits with that.
Have a great day.
You too, Doc. Dr. Vince Akimoto. Love him. Never one to mince words at all. How alarmed are you by the things that he's saying, calling for removal of Dr. Maglotnia and I believe the territorial epidemiologist, Dr. Amplebutski?
Are you asking if I'm alarmed?
Yeah, I mean, are you? Or is that something that, we have a doctor out here who's...
At this, I'm more shocked that we're not getting basic information, so that's where I'm at.
Right, that's what you're... Okay. 816-637-0094, our number. Facebook comments, we got that, and then I think we're going to run out the governor's special address here. The order goes into effect in about 3 hours and 45 minutes.
Right, and it'll be in effect until March 30th. All businesses that aren't deemed essential will close down. You will still have your takeout service, so don't worry about that. Laundromats, gas stations, grocery stores will still remain open. But the idea here is for you to stay home.
Yeah, and that's kind of the main point. And I feel like when people hear that there's all these exceptions, they think in their mind like, oh, okay, well, we're going to go to the store. We don't even need groceries. Let's just go walk around. But the idea and the intent of this order coming out is that we need you guys to stay home so that public health can run around and backtrack and trace, investigate, and do all the things that they need to do. We know they're overwhelmed. We know they're understaffed, so they definitely need a lot of room to work with if we're going to, turn the corner on this COVID-19, which I think we're just getting started.
Yeah. But, and I also wanted, again, and I know we keep doing this and we did it yesterday, but we can't say it enough. Thank you to all the medical professionals, the doctors, the nurses, the police officers, the firefighters, the National Guard, everybody that is working on this containment. We really appreciate what you're doing.
It's 8:17. Bree, we're going to take a little break and we're going to come back with more of Containing COVID right here on KUAM News. Good morning.
Off a day, a lot of people are talking.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
821, containing COVID, KUAM News Takeover, Guam's favorite I-94. It is our intention to be with you every morning, except Saturday and Sunday. It's my kids' time, man. Sorry.
And I gotta sleep at some point.
Yeah.
Actually, I'll still be working, but just from home.
You don't sleep. 822. We wanted to bring Senator Kelly Marsh Titano onto the show here. Morning, Senator.
Oh, off day.
So I guess, first of all, we just wanted to ask you, and I know it's kind of, I don't know if it's a moot point now that the governor has instituted the social isolation order, but you were one of the senators who sent this letter to the gov asking for a lockdown, asking her to reach out to the FAA to ban flights coming in. Can we just quickly just get your reaction on the governor's rejection of that idea?
Well, I wouldn't say it's a full rejection. I am pleased that she took a more serious stance and a stronger stance on us having isolation and social distancing. Those elements we of course would like to see more implemented, but we are. My understanding is that those of us who wrote the letter are appreciative of the fact that she has implemented stronger actions towards what we were getting towards, and we hope that as things unfold, she will continue to do what she can to strengthen the protection of us all, because of course what we want is protection of us all.
Right, and so that's kind of the feeling that I got, is that you guys had asked the governor to do one thing, what some people would call an extreme thing, and instead she gave you a couple not as extreme things. So it was kind of a trade-off, right?
Right. Well, I know she has a lot to balance out, and we all want safety to be the first and foremost for all of us. So we will continue to get to where we need to be with those actions, I'm sure, or we will continue calling for those actions to be implemented so that we're containing this as much as possible.
Is the legislature monitoring the situation with the people that are on quarantine and some of the concerns that they have been raising in terms of how unorganized it is and the lack of staff at these hotels, that they don't have PPEs? Have you heard anything at all?
Well, we're definitely keeping an eye on it, and hopefully we will be able to have a conference call where we can all talk together today and see what needs to be done to move forward. A lot of our time, and I'm glad we're able to do it, is to field constituent concerns, to be able to reassure people, to be able to just relay information that helps them understand how to navigate through the situation that is. So I think that's important, but I do think we need to be continuing to look at all of this and make sure that there's as much order as possible, that the message is as clear as possible, and people's safety and health are first and foremost, as I was saying.
What are your constituents asking you, Senator?
Well, some of them were asking for just understanding about a lot of the flights that were coming in. They wanted to make sure that their family members were able to get here, and they wanted to make sure that they understood whether or not their family member or friends might have to go through that quarantine process. So they were just asking for confirmation on that. Those were a lot of the concerns as well. We've also had some discussions about the fire watch and some of those other issues as well. My heart really goes out to, and I'm so appreciative of people who have been out there fighting fires already, and it's a shame that, especially in this really stressful time where we're trying to do our parts, that they have to go out there and additionally take care of other safety concerns on top of all the other safety concerns we have right now. And so I'm really, really hoping that we aren't going to be having any more fires set at this time. We're already so stressed and focused on these other issues. I really hope that the fires are going to be kept at bay.
Right, and so I'm thinking that it's the same thing with with first responders. They're kind of busy now with COVID-19. Same thing with you guys. Don't do anything stupid around your house you're gonna get hurt. You end up having to go to the clinic because we really need all the medical resources to be kind of focused on this COVID-19. Senator, I'm thinking less fires. Possibly less man-made fires because everybody should be staying home.
Well, one would hope so, but I know that firefighters have been out there. Just the other day, they were fighting fires in several locations, Cross Island Road and other places where they were fighting fires for a couple of days. So we haven't had a fire since those, I don't believe, and I hope that the community is going to just consider the rest of us, consider caring about one another during this time, and not be setting any more man-made fires anyway.
Right.
Do you feel the community has been fully informed of the situation?
Well, there's a lot of information going on out there. It's being released rather continually, and so those are some of the phone calls or the messages that I'm receiving. Is some of it is just trying to navigate their way through the messages, and so part of what my office has been doing, and myself personally on Facebook and Instagram and Twitter, is trying to find those messages from the World Health Organization, those messages from our government, our different agencies, or our different offices that are clear, they're simple, they're concise, and to just be putting those out there so that they can be passed around. I think, that's one of the things we can all be doing for each other and all have a role in this, I would say.
Okay. Go ahead.
I was going to say thank you, Senator.
Well, and I wanted to mention, and this is something, during this time, it's important to have these rules of understanding these rules of safety, social distancing, washing our hands, good hygiene. And so I noticed that one of the people, I think it was on Instagram or Twitter, but I really liked it, and so I wanted to pass it on. It said the tomorrow COVID-19 rule number 1, and it said, wash your hands like you would pick Doni Sali and your eye was itchy. And I thought, that's so clever. When I've been told over and over to wash my hands, or we should all be washing our hands for 20 seconds, 40 seconds, 60 seconds, it seems kind of abstract, right? It's like you stand there and you're washing your hands and you're trying to count or sing a song.
I just do Finogi Chamorro. That's what I do.
Long. But I when I read that, I thought, oh my God, if I was washing my hand after picking Doni Sali and my eye was itchy, I totally get it. I would be washing my hands so thoroughly, every nook, every cranny, under the fingernails and everything else. And I really thought that put a perspective on it that we really could gravitate towards. And so I encourage others to look at those other rules about social distancing or what have you, and to challenge themselves to come up with a local spin on it that helps us understand it, but also want to implement it, and to provide perhaps a little bit of lightness in a very, very serious situation, not to take away from the seriousness of what we should be doing, but to keep things light as we remember to do them and implement them.
Yeah, don't forget to laugh. There's a saying about it being the best medicine. But thank you, Senator, so much for your time.
Thank you. Be safe.
All right, there you go. Senator Kelly Marsh, tight to know. Let's get from the Guam Election Commission, Maria Pangilinan on quickly. Maria, I know you guys had the meeting yesterday. My Jotnia people heads up about the special election. Was there a decision made whether or not to have and hold the special election last night?
The decision was not made last night. The board will reconvene today at noon, hopefully with the medical professional present, to consult with the board.
And so you guys, what I'm hearing is the board wants to consult with a medical professional to find out how feasible it is to still have the Jotnia special election.
That's correct.
Wow, that's, you guys are meeting at noon. There's an executive order that came out, right, Ms. Maria?
Yes, I do. We feel that, this is important, and according to, we are abiding by the executive order.
Okay.
Okay, so you're going to socially distance the board members.
Even yesterday we did.
How did you do that, Miss Maria? I'm curious.
We had 2 6-foot tables.
Everybody had a table?
Wow.
Everybody had a table, and they would sit at. So we had the 12 feet.
Right.
So each board was at the end of the table. So they were 12 feet apart across the way, and then 6 or 7 feet apart next to each other.
So what happened?
Who's got the picture?
Yeah, I want to see that. And then what happened if they need a pen? Like, hey, pass a pen over here. Oh.
They all had their own, and that's one of the options we were thinking about. Is for the voters of Jotnia, if we were still to have the election, we'll buy the little pencils like at the golf course, and we'll have them keep it.
Well, all right. Thank you so much, Maria. I guess we'll check back in with you after the 12 o'clock meeting.
Miss Maria, so what do you think, though? I know you're bored. I really thought they were just going to shut the whole thing down last night. Is there some maybe outside force that wants this election to go through, or is it just that they kind of want to get it over with? What was the discussion like?
It really they're really concerned about making sure that the island is safe, and that's what they want to learn it so that they can deal with the special election much better.
So you're kind of implying that we are going to just go ahead with the special election, or I mean, what is the health professional going to tell you?
Not true. I'm not implying anything. We just it's the board's decision, and the board will consult with the medical professional. And then hopefully they'll make a decision.
If this does go through, are your employees prepared in terms of like having PPEs?
We are getting prepared, and again, we hope to get the assistance of we hope to get some consult with the medical professional. And Sabrina, we also are looking at the U.S. Election Assistance Commission website. We've downloaded the CDC guidelines for elections, and we're looking also at what's going on across the nation.
Okay, sounds like you got your plan together, Miss Maria. Thanks for checking in.
Thank you.
All right, there you go. Miss Maria Pangilinan, Guam Election Commission. Wow, so they might have that special election. That's kind of
surprised.
I'm very surprised. I don't know why the governor's not shutting that down.
When's the election?
Next Saturday. Yeah.
What day is that?
Or March 28th. It's supposed to be.
Oh yeah, that is within the.
So yeah, we're still going to be on a
directive.
lockdown. I mean, there's all kinds of issues there. First of all, how do you keep less than 50 voters from congregating?
And there's 2,000, I think she said yesterday, registered voters in Jotnia.
Yeah, I'm not sure
how.
how.
Might be low voter turnout.
Yeah, well, that's the other thing. I mean, imagine winning a mayoral election in which only 50 people came out to vote.
10.
Right, or 10. 8:34. Nestor Lecanto's working on a bunch of stuff, and he was also able to interview the Adelut policy director, who is, I believe, is kind of running the JIC. It seems like, because he's the guy with all the answers, Carlo Branch. So we want to bring Nestor in here. We know there's just a bunch of stuff going on too with the hotels and this quarantine. So can we get Nestor on?
Yeah.
Come over, Nestor. Yeah. Nestor Lecanto, again, to the KUAM News team, man, working long days just to kind of get the info out to you guys. And good morning, Ness.
Good morning, everyone. So yeah, hopefully we'll get Mary Torrey. She's been a very busy woman the last few days.
She's actually on the phone.
Oh, she is, yeah. Or they're getting her. Yeah, go ahead.
Sorry.
Okay. Yeah. As you mentioned, Chris, a bunch of stuff going on at the in the hotel and restaurant industry. They're I guess in the midst of a real bad time right now. So hopefully Mary will be able to shed some light on what the situation currently is and what they have planned once we get over this. Because we will get over this, folks.
Yeah, we will.
Hang in there.
Ness, I wanted to ask you about your talk with Carlo Branch yesterday. Maybe a little summary, some of the takeaways.
We just discussed a little bit. Most of what we discussed was about the governor's executive order and her reasons for doing so and her justification. I asked him to kind of compare it to what the Democratic majority and what the Guam Medical Association had been asking for, which was a complete shutdown of the borders. And he generally, I think we talked about this before too, that I think their position is that, by imposing those restrictions on the flights, it in effect does the same thing. So,
right.
So he talked a little bit about.
Yeah, I mean, we interviewed our friend Dave, who is actually in quarantine, and if we could share his story with anybody who's even thinking about coming to Guam right now, I'm pretty sure they would cancel their bookings. Because, I mean, from what Dave was saying, it was just, whew, boy.
Yeah, and I think Carlo acknowledged that,
Right.
that was a last-minute decision that they had to make
course.
because they were responding to, in particular, President Duterte of the Philippines, I guess his order that international flights
Right,
would
yeah.
be shut down. So they had to do that, and he acknowledged that perhaps they weren't properly notified or they didn't have time or they didn't have all the resources to
Sure,
be able to
sure.
They
let
didn't have
those,
their plan
those
together.
passengers.
Well,
Hey,
we
so-
do have Mary Rhodes on the phone now. So
Yeah, let's get Mary on. Good morning, Mary.
Good morning, Chris.
So welcome to the show, Containing COVID. Just quickly, GHRA, people want to know, assess the situation, what's going on with the Guam Hotel and Restaurant Association.
Well, thanks for having me.
We're definitely glad you came on. So, if you could just tell us where GHRA is at with this order that came out. We do have Nestor here, too.
Hi, Mary. How you doing? So how are the properties doing right now? Are they all still operating at this point?
Majority are, yes. As most would understand that we still have guests, right, in-house. Some properties are as low as 8% up to almost 50% still. We still have had travelers coming through this last week. So through next week, we're expecting numbers to go a little bit below 30%. And then the week after, I'm hearing arrivals are down to about 20%, down to zero.
Yeah.
So as cancellations and airlines continue to make changes, those numbers will fluctuate. And so I think that the hotels are already anticipating a severe drop in arrivals from 0 to maybe 20%. And so what we're doing is we've been working with some of the hotels to possibly consolidate some of their guests to properties where they can service all of them. And then for the last 2 weeks, GHRA has been working with the government of Guam to identify facilities, not just hotels, but facilities in general, that can serve as mass quarantine for any of the asymptomatic travelers, both resident and non-resident. Remember, we have two protocols. One in particular for Manila, because that's where all our COVID cases have been realized, as travelers who are residents from Guam traveling to and from Manila. So those facilities are serving as involuntary quarantine locations where they were automatically taken there. And then we have any of the non-resident travelers who already had pre-booked plans to get to Guam and they cleared public health. They are within properties, but they are on quarantine floors. Regardless, though, wherever they're at, if it's a hotel or a quarantine facility, please know GHRA has worked closely with Guam Police Department, Guam Fire Department, Public Health, and Homeland Security, and even the front office at the government of Guam with the executive branch to ensure that we have proper government personnel there to really coordinate the services. The hotels are only really providing back-at-the-house operations, so really helping with room access and giving that to public health, not so much the guest or the traveler. And so they're really providing back at the house, coordinating the rooms, any linens, housekeeping, room service for food delivery. But all items should be delivered through the security of Government of Guam and Public Health. So we have GPD. We haven't activated the guard yet, but we have GPD and fire working together with Public Health to man those hotels.
Okay. What can you tell us about F&B operations as a result of the governor's executive order? Of course, there's no sit-in service, but are the hotels prepared at this point to do takeout, or is that not something that they're interested in doing at this point?
I think the hotels at this point are focusing on the in-house guests and providing in-room delivery when required. But as far as restaurants, I know that they have actively been, looking how to continue business and provide services to the community in general at large. And so a lot of businesses have really come out and provided new types of services like takeout or delivery services.
Okay, what can you tell us about layoffs given the huge drop in occupancy?
Well, just one more thing to add. Drive-throughs are also allowable. I know initially it was said no, but drive-throughs will be allowable together with takeout or delivery service. And then also catering, because we have to provide mass catering to certain places with quarantine, right? So what was your other question? Sorry, Nestor.
Layoffs. What's been the impact of the drop in occupancy on employment?
Well, already we started the discussions about 2 weeks ago with the governor and then also with Department of Labor, knowing that once the numbers drop below 30%, which was the expected number when she released her economic measures through Team Guam, it was very important that we start activating certain programs in anticipation of layoffs, despite the social isolation executive order she released yesterday. So we've already been working with Department of Labor. Unfortunately, they are closed at this time, but we have been working with communications with the director, Dave De La Sola, to make sure that we are still communicating programs like the dislocated worker that is federally funded with the U.S. Department of Labor. Businesses have to go through certain procedures in order to go through the process with them so that they can put the paperwork together in order for their employees to become eligible for that program for retraining and rehiring with other businesses or other trades or industries. So we have the dislocated worker program. I know that there are different campaigns or bills that have recently been passed with regards to possible covering of sick leave if you're at home, but also the $1,000 per person. Right now, I've asked Department of Labor to research that on what the process is so we can educate our private sector members and also the public on how they can attain those benefits and submit their claims. It's almost like during a typhoon when we have FEMA out and they get those checks to sustain themselves. I believe the process will be similar to that, where individuals who are U.S. citizens can come in and receive those benefits. But we need to coordinate services, and so they're currently researching that of who's eligible and what's the process going to be like for the administrative procedure.
So for more information, do you recommend that employees check in with their respective HR departments?
Yes, but we also need the cooperation of the businesses because GHRA is sending this information out, but unless you come to us and notify us that you are looking for support services for when you're looking at any reduction in force, layoffs, or furloughs, we need to know that so we can activate it. We are focusing, of course, right now with some of the larger entities because they've already notified us. And so those are hotels. I think that the larger retailers right now, they are just temporarily suspending services, but they are not going to be cutting back at this time. I think that a lot of people are just allowing people to take sick leave and then personal leave first. And that is our recommendation so that we don't have a mass layoff, is exhaust as much of the sick leave and then the personal leave. And then we will get the information out once we hear from Department of Labor because the president had put together that bill where everybody will get 2 weeks of sick leave at least. Yeah. So that's very important that we notify the private sector. So that way we can kind of push the timeline of when they activate letting people go. Because as much as we can save a layoff, the better. But we understand that they can't continue operations at the same time. And so they have to right-size operations and really think about the total cost of doing business during a crisis like this and when they anticipate to reopen doors. So it might be a temporary situation, but that's why we want the assistance of Guam Department of Labor together with GHRA, because in order for certain people to get benefits or get into a program, you have to qualify by notifying employees and giving them enough time frame. You can't just let them go and call it, a layoff like that. You have to give certain notifications, and are time requirements for that, like 60 days. And then you have to offer packages, right, or at least benefits. So we need to ensure that we educate the employers on how to do this if their employees are going to benefit from programs.
Right, and hopefully it will be sooner rather than later. But when this is all over, what about the return to work process? Are they automatically rehired, or do they need to automatically get their job back, or do they need to go through a rehiring process?
Well, if the company is going through the dislocated worker program, or the employee is going through it, there is a process of the rehire. Whether they want to retrain and go through the program, and they have to cross-train and go into new trades. If they just rehire, they may not be eligible for certain things. So it's there are a lot of details in it. And so, Nestor, I'll forward you the links to the website on the U.S. Department of Labor. It's actually through the Workforce Investment Opportunities Act, which is a federal fund that Guam Department of Labor has been receiving for decades. So I sit together with James Martinez and other members of the business community, and Maria Connolly is chair. She was supposed to meet with our membership this last Thursday, but of course we had to cancel meetings. So Maria has really reached out, wanting to make sure that we educate businesses on the proper protocols to qualify and to have their employees eligible for these programs.
Yeah,
because if you rehire them, there's actual benefits to the employers as well for rehiring and retraining people.
Mary, I was just wondering if you have had any conversation, any dialogue, any contact with anybody in the government of Guam or the administration indicating that this shelter-in-place order, this government-wide shutdown, is going to last beyond March 30th?
It all depends on the COVID cases. So the executive order only goes through March 30th because it's only allowable for 30 days. So if our COVID cases keep adding, then you're supposed to add another 14 days to that. So she may very well extend it past March 30th if we continue to get positive cases, because we have to allow enough time for medical personnel to do the public health to do the trace back, and for medical personnel to do treatment. And so as long as we have active cases, then it's going to be an additional 14 days from that day. And so she may very well need to extend that out.
Okay. We have that a really big property that is supposed to open, I believe, next month, the Subaki Tower. I imagine that might have to be pushed back.
Well, we just got clarification yesterday. One of the essential businesses that will be allowable is general construction. I know that the initial statement or executive order had listed construction only for public housing and public utilities and public works, but we did get clarification that construction for general industry as well as military will be allowable.
We got a question from Facebook, Grant, for the fact that we are in a...
Can I just add to that real quick, though?
Sure.
I believe, though, they're still enforcing the social distancing and no more than 50 at a time. So even though construction projects are on, they still have to, similar to like even in the hotels or any place, that you still have to keep under 50 at a time, and then with the requirement of 6 feet for the social distancing.
Okay. The question was, we are in a global pandemic now. For those that are still working or continuing business operations, should we be getting hazard pay for this?
That is really... I think that's really more of an insurance type of question, and I don't think that Guam has hazard pay except for those in the military possibly, or even in certain industries.
Well, I think you just gave about 10 senators their next bill idea.
Well, there's a lot of things to be considered. I think that even on the federal side, with Congress, they're considering a lot of other options, right? Because I heard just yesterday there are certain industries that are going to be completely shut down because of tourism. So I know that there is a tourism stimulus economic package being considered. And then now with regards to the employees, if they're going to have a particular package because they're all dependent on that type of industry. And so it affects everybody from airlines to servers to retail. Anyone in the service industry is more greatly affected because we're basically cutting off travel. And so I know that Congress is considering a tourism stimulus package for businesses, but also looking at an employee package on the individual basis. So I think it's important that anyone at the legislature who are looking at these kinds of things, that we kind of not do it in a vacuum and inundate our community with additional laws that might already could be being considered at the federal level, or programs that already exist. For example, on the unemployment, I think it's important to coordinate together with Guam Department of Labor on that, because we already have programs that serve and other social welfare programs between what public health provides and what Guam Department of Labor provides. I don't think that we necessarily need an unemployment bill, because we already have programs available for those who are unemployed.
That's the measure that the Vice Speaker has, I guess, put out there, the
right.
local unemployment. What have you read about the tourism economic stimulus and the stimulus for the employees? Do you have any more details on that?
No, I can get that to you as well. I know that it's been in discussion, and so I just saw that on the national news last night, and so I forwarded that already to Guam Department of Labor's Director, Dave De La Sola, to research.
Mary, so are you in dialogue communication with Dave De La Sola? Because I know they were deemed a non-essential agency, and I've been trying to reach out to him because we're getting a lot of calls, exactly about displaced workers.
Yep.
We're not really getting anything from him, so I'm just curious, to your, as far as you're concerned, is Department of Labor doing what they need to be doing right now to help displaced workers and those affected by COVID-19 economically?
Well, DHRA is a private non-government organization, so that is why we always provide services during times of emergency, where we represent private sector and the industry employees. Sure. So at any time, we're always active. And so when the government of Guam, it's at their discretion with which agencies they consider essential, but that still doesn't prevent me from contacting the right individuals.
Right.
So Dave De La Sola has been in communication with me regarding these programs, because it is a directive actually from the governor when we had the economic measures meeting. She felt that was important, so we could at least bridge with each other and provide a service to private sector to ensure that we are helping to promote the programs and educate businesses on what is available. As far as coordination of services at this time, all we're doing is coordinating via phone or email, but my staff, I have one dedicated person who is actually reaching out to private sector to make sure they know of the programs. So when Department of Labor reopens, then we have a go team to go out to the businesses and start getting them signed up. But we are encouraging that they not again consider layoffs. They exhaust all sick leave first and personal leave, because they may be allowable to submit for 2 weeks anyway through this federal program.
Right.
But I've looked at the details for that, and it's really for people who had to be quarantined at home. So there might be a medical form that will be required, that if you had sought medical treatment, you would qualify. So most companies have sick leave policies. So even my staff, I've said, our sick leave policy is in our employer handbook. It's anything sick over 3 days, you have to get a medical leave form, right? So, but right now it's challenging since some clinics aren't operational because they're serving the overflow of the hospital.
Right.
And so how do we address that? But with regards to Department of Labor, I know that I've been in contact with them only because I coordinate services.
Right.
But I think for overall general inquiries, they're probably they won't be operational until the governor
Right.
allows them to.
That's something I disagree with. I think there's a lot of workers out here who are who have been affected, who are going to be affected, who are probably experiencing a lot of anxiety. And I just texted Dave and said, "Hey, you got to get some info out here for these people, man."
Yeah, so that's why we've been sharing it in all our messaging. Is if you look at even some of our previous GHRA messages, we have talked about, like, Maria was supposed to come out and speak to everybody. So it's not just Dave, there's a chairperson for the board, and the board is the Workforce Investment Opportunities Act. And so that's where the funding comes from, and the decisions are made too. It's through that board.
Maria, I thought it was interesting that you mentioned employers use personal leave as an option. I am friends with a manager that was with a group of restaurants, and they met with their employees yesterday, and that's what they said. They said, "Hey, first, you guys are on vacation. You know what I mean? We're going to use that personal leave." So
yes.
there are definitely ways they could be creative.
I don't want to say which, but they've been very generous to their employees, and they're considering closure. And they've already agreed to not tap into sick leave and personal leave. They're just covering 2 weeks of leave already.
Mary, do you imagine that some businesses may be forced to close their doors for good as a result of this?
I've been notified. I don't know about for good, but I have already been notified about closures, including hotels. So we're double checking whether or not it's permanent closure. I know that one is looking at a permanent closure, which
one?
Hotel. I can't release that right now because we're still validating it. But I know that there are general interests out there that when the number drops down to below even 10, right, to 0, then they will consider temporarily suspending services until they can be operational again. Because we all have to remember it's a full facility where they may house several hundred employees, but it's also power, water, cleaning services, like all kinds of costs that are included in the operations of a large facility. And again, not just hotels, there's restaurants and retail outlets. A lot of stores are closing especially as of today, but some have already chosen to close. So this is a really wide-ranging, very wide and deep kind of a initiative for the social isolation. I think it's still the right thing to do for the community, but at the same time, it'll have huge ramifications for a very long time.
What's your sense of the mood of the hotel and restaurant operators? Are they fairly optimistic of a rebound eventually?
I think this is very challenging because first and foremost, I don't think anybody knows how quick the rest of the world will rebound. I think that everybody is approaching this differently, which is what's challenging. Singapore is a great example of how they've approached it, but every government is different. And so it comes down to how soon you can contain it. The earliest you can contain it, the better for everybody in your own market. But I think that the governor has, although she can't close the airport, she has made it as restrictive as possible, where airlines are already choosing to change out their schedules or just not fly to Guam because it's so restrictive and it's putting tourists in a mandatory quarantine, right? So I think that part has been handled as far as she can handle it without closing. But how we contain it is number one, and then also how we choose to communicate to our key market segments, and that's where GDB and GHRA are extremely significant in this, is how do we reopen our, not just ports of entry, but our relationships.
Right.
And so everybody is watching how we're managing this, and that's why it's very challenging. It has been extremely challenging on the tourism side because of the way, we have been handling mandatory quarantine and protocols, because the markets are looking at how we handle it.
Yeah.
And so I think that Japan and Korea, for the most part, our key market segments, everybody is always going to have, good and bad things to say, but it's about maintaining the relationship and making sure they understand that we're doing what's right for Guam, but how can we move forward and ensure that we maintain those relationships when we do reopen. Then it's not back to business back to usual business, but at least how do we gain the confidence in those markets so that we can start adding some positive numbers.
Yeah, I imagine the after-crisis marketing will be very, very important because there will be pent-up demand. People will want to travel once they feel reassured.
I'm just going to want to eat out and sit in a dining room.
So yeah.
Yeah, but I will tell you, markets look at how places responded, right? Destinations respond. And so I know that GVB, we have a coronavirus stakeholder group, and I know that we already have our recovery plans, but that's still on hold because we're not there and it's still being reviewed. But GVB, we've been through this so many times before with different kinds of not just pandemics, but just any kind of situation affecting our destination. And so just know that the team has really been working hard to ensure that we are ready to activate when we need to, just like what the hotels and restaurants do. And it's not just GVB who promotes the market. Hotels and airlines have the huge responsibility and probably even larger budget than what GVB has when it comes to marketing and promoting our island as a destination. So there needs to be a consolidated and coordinated, unified effort when it comes to promoting Guam between the airlines, the hotels, the transportation, travel agents, Counselor Corps, and GVB. And so that needs to be our main focus once we are getting everybody on containment. Our main focus is how do we really start having those conversations on how we've approached the whole situation, and then how do we move on from there so we could really educate our markets about how we've been performing.
Hi, Mary. It's Sabrina. I have a question. You were talking about promoting the island and all of that, but I was just curious if GHRA was involved in that promotion that went out by the governor and the lieutenant governor promoting visitors to still come to Guam during this coronavirus outbreak.
No, GVB has the full responsibility of the marketing and promotions of Guam.
What's your response to that?
Our mission is to advocate with government entities for compliance and regulatory, but also to train, educate, and to provide assistance to our businesses, our stakeholders, especially the employees. So that's why training and education is extremely important for us for workforce development. And so that's the core of our mission, is really more the internal part of it and the operations of what's going on between businesses and with employees in the industry. GVB is responsible for the marketing and promotions as well.
Was GHRA involved with in helping come up with this mandatory quarantine protocols?
We only were involved at the time when it was identified that they were going to go with it. And then what GHRA has been actively doing is working on the frequently asked questions whenever we field questions and working with GVB on that. And then also identifying some of the operations of how it's going to be implemented. So all of the protocols, we had stakeholder meetings with hotels, they had meetings with airlines. We also had meetings with all of our agents, Counselor Corps. So it's based on how we implement it. Once the governor identifies what her and her cabinet members and her key agencies want to do, then we look to implement. I've only been giving advisement on really with tourism specific issues and on implementation of plans.
Okay, Mary, we definitely appreciate your time. Wow, you got a lot of information out, so valuable, and thank you again.
Thanks, Mary.
No, thank you for including us.
Of course, Mary.
Okay, be safe.
Okay, you too. Wash your hands.
Yes, thank you.
Okay. I'm just doing my part.
That's right.
Hey, we're going to take a break. 9:05 coming up, the Crayon Lady.
Stop.
Yeah, sorry. So we're going to talk to one of Jay's friends here. What do you do to keep your kids busy, to keep them occupied? What are some cool activities? Because they're probably getting cabin fever. You know how kids are. So we're going to talk to Adele in the 9 o'clock hour, and she's got some really cool ideas, ways that you can keep your kids engaged and busy, and keep them really from saying "I'm bored" for the duration of this shelter-in-place order. 9:05 or KUAM FM, Hagatni, Guam.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD. healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Containing COVID 915 KWM News. Take over, Bree, real quick.
Yes.
The
Coffee's kicking in.
Latest information, the results, the testing that we got late last night.
All right, 7:15 p.m. 4 more new positive cases of COVID-19 on Guam. They tested 16 individuals yesterday. 4 tested positive. That brings the total number of positive cases of COVID-19 on Guam to 12.
There you go. And if you were listening to the show, and thank you if you were. If you weren't.
Or watching.
Just so you know, Dr. Vince Akimoto called in this morning and said that they've already swabbed several patients and are awaiting public health to pick up those samples for testing today.
And a lot of you may have been, we've been trying to keep track of the test kits. We weren't able to get a definitive answer from the governor's spokesperson out of the Joint Information Center.
We did get a definitive. She said we have enough tests.
We have
that reminds me of my mom. You know what I mean? Mom, how much? We have enough. Stop asking.
Comfortably, right, for the next 3 days?
She can comfortably say that for the next 3 days. I mean, the point, though, I think, is they're trying to get more. She said they're doing everything they can to try and get more. So there you go. Comments?
What am I reading, Jason? Oh, okay.
Yeah.
You can come on in here.
Yeah, come on in, Jay.
Come in.
Come on, girlfriend.
Instead of giving me the phone and confusing me.
Yeah.
Okay, hello and good morning, everybody. Wait, am I even in frame? Okay.
Not too close.
Okay, yeah, I know. So social media and social distancing, that is like the big thing. Okay, we are keeping track of each and every one of your comments, and you know the one thing, you guys, that I have always appreciated working here at KUM. I mean, between the three of us, we've got almost 75 years of Guam news gathering between us, and this is something that none of us have ever even come close to seeing before. What's transpired over the last few days, the pace of it, the tempo, the intensity, and everything. But we have the smartest viewers in the world. The people that are commenting on this thing, I mean, you guys are respectful. You guys are keeping it positive. However, there's a lot of confusion. There's obviously and understandably a lot of anger. There's a lot of people upset from a variety of reasons. But one comment, and I'm going to use you, Lizelle Kindo. Thank you so much. We got your comment up here, popped up and everything, because we're going to use Lizelle's kind of as a collective for what a lot of people are saying. Someone needs to help us understand why she, obviously referring to Governor Leon Guerrero, cannot or will not shut down flights, and why. They're just trying to understand that. And everybody's
kind of late to the party there, girl.
Yeah, well, everybody's just saying the solution, at least in their idea, would be so easy as just lock everything down. The physicians have said exactly that.
Yeah.
It's an ever evolving issue, and it's it's not really that simple. You make one decision, it affects like 3 other parts. You make something,
Yeah, it's not that simple, but I don't think it's that hard either.
No.
I mean, what
cannot shut down
she cannot shut down the airport, but she can ask. They can say no, and then she can hold passengers inside the airport. There's a lot of stuff that they can do, but I thought Carlo explained it well for what it's worth. That instead of getting the lockdown on flights coming in and out, what they have done is implemented very strict quarantine policies. And they're also, we're going into shelter in place at 12 noon. So I've never been one to defend any governor, but I'm just going to say that people have been calling for her to do more things to protect the island. And I think that she has done that. Was it in time? Could other things have been done earlier? Of course.
Well, speaking of these shelter in place, okay, so some people are saying shelter in place. Some people are saying social isolation. That's the official word that came from Adelup. Like that's their, their nomenclature. Let's call it. Other people are saying like lockdown. Whatever you're going to call it, quarantine, social isolation, lockdown, shelter in place, whatever. We do have a poll up. It's on Facebook right now. So if you're watching us on a desktop, it'll pop up at the bottom of the video feed. If you're watching us on a mobile device, you just got to go to where you can add a comment or the little reaction emoji. If it doesn't already pop up with like a little bar chart, then just slide to the left and you can actually let your voice be known on our poll. How ready is your household to quarantine or go into social isolation? When you got 3 options, guys, you can either say, I'm totally ready, I'm somewhat ready, or I'm not ready. And we want to get you guys up to speed on what the results are. On Twitter, somewhat ready is the biggest one and not by much. Somewhat ready has 46%, not ready at all has 28%, and I'm ready has 26. I don't know about you guys, but I could say I'm probably a strong somewhat ready.
I know. I am too. What, Chris? What are you?
What's in between not ready and somewhat ready?
Kind of, sort of.
Kind of, sort of ready. Like we could go, but what I was thinking this morning when I did my cabinet check is I want to get more. I want to be able to have enough supplies to not leave. If theoretically I'm coming to work, but to not leave the house for 14 days. And right now we wouldn't last over a week.
I went to Payless and Derrida last night when we got off work. So I was there at maybe about 7:15. And I got to say, from a consumer standpoint, because as soon as we leave here, we're getting in line just like the rest of you and everything. I mean, it was very, very civil. Kudos to Payless Derrida team. I know a lot of people there, Carmelita and like all of her colleagues. They're very helpful. They're keeping a positive attitude. They're incredibly efficient, so they're getting customers through. And the consumers themselves, I mean, some people may be in this panic buying mode, but no one's really hoarding. Everybody's respectful of each other's space. Everyone's, lining up. There's no real rage going on and everything, which I thought was fantastic. I mean, the way people are.
Yeah, we didn't really rage, man. As much panic buying that was going on, there was no there was that video at Walmart where they were fighting 2 ladies were fighting over toilet paper. We don't really get that.
And I just want to say, again, the fact that the 3 of us have been doing this so long individually and collectively, I'll wrap with this is that, I'm actually very proud to be a Guamanian in the middle of this, because the fact that we've got, on store shelves a shortage of hand sanitizer and isopropyl rubbing alcohol and toilet paper, not so much, but just the fact that there is a shortage in that, it just proves that people are paying attention and people are getting it. This isn't one of those events where people say, oh, okay, everybody's just thinking it's going to blow over, or everyone's at the beach, goofing off. People are really staying prudent and they're paying attention. And again, we're being respectful and we're taking care of our neighbors as well as ourselves. So everybody out there, great job by you. Let's all be safe and let's all be good to each other.
Well, there you go.
And when you go to the store, thank your cashier, because they are working their butts off.
Yes, he's been practicing social distancing since 9th grade, 7th grade.
No, out of the womb.
Unintended social distancing. 9:20. Let's get Adele on here. We've been talking about this all morning. Morning, Adele.
Hey, good morning, Chris. Sabrina,
good morning.
Everyone. Morning. Thanks for having me.
Of course. So you have a cool little idea, activities, keeping kids busy. They're going to be home, should be home. You stay home for, the next 10 days. So what do you got cooking? They're calling you the crayon lady, Adele. Tell me why.
No, I've never heard that before, but I'll take it. Thank you. So I'm an elementary school art teacher with the GATE program, but I also run an Instagram account, and it's called Shake the Box _ between Shake and Shake_the_box. And in the past recent days, I've just been sharing ideas of what parents can possibly do at home with their children that's art related. I didn't create any of this. This is not my creations, but I think that it's worthwhile and share-worthy. So when I come across it, I feel like, maybe some parents can relate, and I just put it out there, and, they can take it for however they want to use it.
All right. And so if you could just give us a few things that they can do.
Okay. Well, my first post 3 days ago, it's called Invitations to Create. It's a guidebook with about 30 ideas where parents, it's low prep, okay, so, parents don't need to be scared. It's extremely low prep, and the reason why they say Invitations to Create is you kind of leave it out there. You explain to your toddler or your young one what the possibilities are, but really at the end, they make of it what they want.
Wow, that's cool.
Yeah, so really you don't have to sit there for the whole hour. It's not a directed lesson. It's more like, here are the tools, here's what you can possibly make, and, create. And
Here's the tools, make a big mess. Dad is going to go cook lunch.
Exactly. And I was mindful that us parents, we have some things that we want to get off on our to-do list, right? We want to check off. And we do want to find ways to keep our kids busy. Some of the activities, or a lot of it actually, involves recycled materials, repurposed things that you wouldn't have thought, could be engaging.
Right.
But, yeah, and if you have multiple children, you can introduce it in the same way. And the cool thing is they can all come out of it differently, right? The experience is what we're kind of counting on.
Well, that's really cool. Adele, could you throw out your tag on Instagram for those watching and listening? Maybe they just go throw you a follow and then see all the cool activities you have posted. Sure.
It's Shake the Box. So Shake_the_box. And so every day I've been posting, and I'll
Nice.
keep it to one a day. I'm not going to overload.
Right.
But really, there are a ton of resources out there. You can look up homeschooling. You can look at art at home.
Right.
There are amazing teachers who are working from home, spitting out lessons and websites and, even low-tech things that you don't necessarily need an iPad, but really engaging things that students can do from home.
Right. Thank you so much, Adele. That's really awesome. And, it's very, very issue specific, especially with COVID-19. You're starting to see nationally a lot of teachers, a lot of people starting to, hey, how are we going to pass the time? No one's going to school. Kids still got to learn. Thank you so much, Adele. 926. Let's get the Legislative Health Chair, Senator Therese Terlahi, on the phone. Good morning, Senator.
Good morning, Chris. Good morning, Sabrina.
Good morning.
Thanks for listening. And just real quick, I know you're checking in. What do you have for us?
I just wanted to make a few announcements, I guess, just to summarize a couple of things that's been going around. So first of all, I think it's great news that the SNU is ready and they're going to be able to move those patients over from the GMH over to the SNS, those who've been confirmed. And future patients will also be able to access the 20 beds that are currently available at the SNU. I think that's great news, and I want to commend GMH for getting that done, and everyone else who had to work with them. I know that they have security up there, and so and nurses, and they had to put very qualified nurses up there. So I'm hoping that worked out very well for now for the community. And I want to thank the doctors who are doing the triage and have increased their urgent care at their clinics, because this is really going to help, keep people who don't need to be at GMH away from GMH, and also help us to more quickly figure out, who's got the virus and who does not. And I feel for Dr. Akimoto and the need for test kits. We've always had this need. We were very limited in what CDC gave us, so it's not public health's fault.
Right.
They were very limited, and so, of course, they've asked for more. And they've been telling us they've expected it during the week. So now the latest word I got was they're hoping Monday. So I hope those doctors can just hold on, and we're going to take the samples. Hopefully they can.
I don't think it's the doctors that can hold on, though.
Yeah,
I know, but we're doing. Everyone going to do whatever they can. So I'm just saying, if we can't control the mail, I'm sure they don't want to promise what they can't give, when they say it's going to come Monday for sure. So, but I'm hoping that it will come on Monday.
And that's part of the reason, Senator, we haven't been able to mimic some of these countries and jurisdictions and how they've been able to flatten the curve is by doing extensive testing of individuals. And we just don't have that ability because, Dr. Akamoto checked in this morning. He said last he heard 75 tests.
That's right. But we had 200. So we should, I'm sure they will be using them all. They're going to use all the tests. I know that's a fact. And they're expecting 400 more. So that's still relatively a limited amount. But, But,
where did you hear that from?
Well,
the 400 more.
I'm pretty sure that's the number that we were told by public health a while ago, that's how many more they would be getting.
Okay.
And then, Senator, just to clarify, I know that they've moved one isolation patient over to the skilled nursing unit in Barragata Heights. We were on the phone with Crystal a couple hours ago. She said that it was a partial opening and that there were still a couple wings that are not ready.
Only 2
That's
wings.
correct. So they're going to move 4 patients for sure. They have 60. Ultimately, they're planning for 60 beds up there. But right now, there's one wing ready with 20 beds. So that's ready to go. The next, and they're going to keep expanding. And even beyond that, they have plans to expand if we need beyond 60 beds. Then we have other contingency plans for that also. So yeah, they're just I guess doing it in phases at this point because we're all trying to catch up here. But I wanted to also announce that all the local insurance companies have agreed to expand their telehealth to cover telehealth so that relatively so that patients can call into their doctors and receive services without necessarily having to go into the clinic. That keeps them all safe at home, hopefully, especially those who are very vulnerable, such as dialysis patients, cancer patients, and anyone else who can, get what they need over a phone, hopefully. They've also expanded up to Medicaid and MIP, so they're also doing authorizations for, services by phone. They've also the insurance companies have also agreed, and the pharmacies are trying to fill this demand to cover extended periods for refills so that everybody can get their medications either early fills or early refills or extended refills for a longer period of time. So the goal is to get people to get their medicines and so that they can shelter in place, for the duration of this.
Right, and not have to run out and be put in a position where they're out of meds or they're compromised and they're out here driving around.
We're trying to keep the compromised, all those with immunocompromised, bodies to stay in shelter as long as possible, not to be going out, not to be vulnerable to those who may be carrying the virus. And I think that's really one of the things that of course, this is really the big message for everybody, is that this virus is in the community. So they've declared it to be, a community-wide. And so we all need to act as if we are infected and that we may be a potential person who is spreading this because we can't confirm that, right? So even non-symptoms, those without any symptoms might be spreading it. And so I think that's what the doctors are, they really want to stress for everyone that act as if you have it. So keep away from older people, keep your distance from people. And that's the reason. This is how we're going to save lives. It's really that individual responsibility. You act as if before, because we're not going to be able to confirm everybody. So just act as if you are contagious and act accordingly. And that's really the kind of protocol we all have to put in place. Whether the government demands it of you or is enforcing it of you, please do it for yourself and do it for those you love, because that's really the only way. And another thing I wanted to just make sure that the pharmacies want everyone to know that they are going to remain open So you will be able to get your medicines. They're having like a rush right now that's a very high volume. That's very hard. It's hard for them to feel, of course, all at once. But so we just want everyone to also not panic about meds, that they will be able to get their meds, and that and you'll be able to get those for extended periods. So I'm very grateful that the insurance companies, Medicaid, MIP, Department of Public Health is working very hard. They've done a lot. They've changed. I mean, they're allowing applications for online assistance of public welfare benefits. Also, you can apply online. They've got phone numbers. They're trying to get these transactions done, minimizing the need for anybody to actually come into there. So I know that, it doesn't cover everybody, but for those who can be covered, and there are people who are being laid off in the interim, I would suggest that they take advantage of the online applications for new benefits, and that,
Senator, I wanted to ask
a list of other things that I wanted to mention. Oh,
right.
yeah, of course, the shelters are still open, so I think those types of services we have to, just keep in mind that, and I know that there are many people who are existing programs. We've got existing programs that are going to cover some people. There are many people who might not be covered. I think Mary Rhodes from GHRA did an excellent job with you just a little while ago. So
Yeah.
I'm very grateful to people like her who are very competent and who are working very hard to fill all the gaps and to make sure that, there are no gaps. But where there are gaps, we recognize that there will be gaps, and that
Sure.
we're going to have to fill those gaps with local programs and local ways to carry people over. Yeah.
But at the same time, I think that we need to take a full advantage of what the federal government is. I mean, there's just so many different. Senator, to kind of backtrack, sorry, there was a video and audio going around yesterday, and we've run this by a few people, officials who have called into the show, just trying to vet it. We've got nothing confirmed about. I don't know if you saw this or heard this infection at GMH, a broke protocol, yada yada yada. Do you have any knowledge of that? Is that something that is unverified or verified?
Well, I heard Lillian Posadas on another radio station this morning, and what happened was that there was a patient who came in with a fever. They did not suspect him to be a PUI or a person who might have coronavirus, but he was admitted to the hospital for whatever symptoms he had. And it wasn't until, I think, 3 days later when the physician, suspected he might have the coronavirus, did a test, and it was confirmed. So because of that, those who had been, I guess, treating this patient or in contact with this patient, they're now, taking measures to confirm whether or not they were exposed to the virus, whether they, it's been transmitted. And according to Lillian, everyone at the hospital is now wearing masks. And,
because they weren't previously?
I guess not everyone in the hospital was wearing those previously on every floor. And as you know, all across the nation, all the PPEs are being really, they're trying to push those to the front line.
Right. In fact, I saw a video yesterday, Senator, I think it was on Twitter. It was a nurse, a doctor had found a way to make more masks out of surgical gowns, and they were showing this quick fix because there's a shortage of masks, and they said, hey, we think we can make 20,000 of these masks, and you get them where they need to go. So I think it's really interesting that the people on the front lines are finding creative but, safe ways to deal with so many of the shortages that we're seeing because of this unprecedented pandemic.
Yeah, people are getting creative, and I think we need to get creative too, of how we stay at home and get things done still, or we stay at home and still not let our parents feel isolated or things like that. And that's what I'm asking the community to do. That take it upon yourself. You don't wait for the government to force you. Just do it. You've got to do it. You've got to act as if you are infected and stop contact with everyone else. Yeah.
Okay, Senator. Is there anything else you wanted to add?
Well, if I could, I would just like to thank you, as you guys are interviewing a lot of people, and I want to thank you for getting the message out there. I think, of course, it's possible the government could do a better job of getting the information out faster, and I still think the more the better, right? That if everybody knows everything, they're going to feel more confident.
Right.
But I do know that the heads, for example, of the hospital and the heads of the public health are working so very hard that they just don't have all that time in the day.
Yeah.
But I do want to commend all of our people working on health in the health fields because they are taking much risk. I have a brother who's a doctor, and every day I feel for him because he's isolated himself from our family because of this, and so that all these doctors, all these nurses, everyone working at the hospital in any capacity is dealing with this every day, that they are at risk and they bring risk to their families. So they're going to have, our lives are changing very quickly. So I'm just saying, do your part. Yeah, please stay at home. I'm very glad that the governor put the quarantine measures in place, the mandatory ones. I very much appreciate that. I think that was very much needed. And so I'm glad to see all the people who cooperated to get that in place. And I'm glad also for her executive order yesterday that closed a lot more things, that put people home. I think we need more. I think the more we do, the less we are going to spread. And because we can't test everybody, because we can't treat possibly everybody, we need to stop the spread, and that's. It's urgent. It's very urgent.
Right, Senator. So let me ask you. A couple days ago, you were one of 10 senators who asked the governor for this total lockdown. Are you saying that you're satisfied? You guys didn't get that, but you kind of got the next best thing.
Well, no. I mean, I think there's still something. Of course, one of the things that we had asked is that they asked for FAA's assistance to stop the flight. So, but I think what she has done is also it's going to be effective. So I'm very grateful for that. And we also asked that for a complete lockdown, right, everywhere.
Right.
But I appreciate how I think we can maybe debate about whether certain things are necessary or not, and that's kind of where the discretion is coming in. But of course, there are necessary things, like food has to get to the hospital, for example, right? They've got to get to the shelters. We're putting people in quarantine. So there's some activity that's going to have to happen necessarily. But we just keep having to trim that down unless it's absolutely necessary, cut it off. I still believe that.
Well, we thank you so much for taking your time and reaching out to us and talking to the community through KUAM. And be safe.
All right. Thanks so much.
Wash your hands, Senator.
I will, of course.
Okay. Thank you. All right. There you go. Wow, a lot of great insight there from that phone call. You see, the thing that I love about us, I'm not a horn tooter, but I like that if we don't get it from one place, we have the means and the sources to get information from a lot of other places. So we definitely want to thank everyone calling in for kind of filling in the gaps. That's one thing about doing investigative stuff is that if you're not getting it here, you can kind of piece together everything else. And so that was pretty interesting that Senator Terlahi has basically said that, they did have an incident at the Guam Memorial Hospital.
Mm-hmm. And we've been trying to get
I got to check my phone because I've been reaching out to Lillian Posadas all week. And I haven't, so I better check that. Okay.
We're trying to get her on the phone.
We're trying to get her on the phone. I think also Dave Sablon, who's our man in quarantine.
I know. Check in with him.
Our quarantine correspondent.
I did talk with him last night, and he was really frustrated. I really felt for him and everybody that's up there at the Days Inn, I believe. Right,
and I feel like the dam is kind of breaking up there. We had Dave Sablon, the videos that he was posting on his Facebook, the story you did. And then he started to see other social media posts being shared by other people in quarantine. There was one I saw where they had dropped a meal to a guy in quarantine, left it in
placed it on the floor.
Right, yeah. And so what did Dave say about the food? Because I know and we haven't thought this far ahead, but I guarantee there are people in there, especially coming from the Philippines. I'm assuming a lot of them, like Dave said, went to the Philippines for medical reasons.
Right. And so, well, according to the protocols I think I saw from the Guam Visitors Bureau, there's supposed to be a public health individual from public health there twice a day or something like that. And when I had talked to him last night, he had just seen a public health person, an employee, show up at like around 7:30 at night. And he hadn't seen anybody else, during the day.
Right, and so
and he's just concerned because there are people, patients that came from St. Luke's on his flight, and he's not even sure are they getting whatever medical attention that they need. Someone on the phone? You guys, like a lot of activity over there.
Yeah, I know. There's a lot of stuff going on. It's a rotary dial phone. That's that's the problem. We're trying to get all right.
Rotary.
Hey, we're going to take a break here. It's 9:44, containing COVID. KUAM News takeover of Guam's favorite.
Let us help you celebrate those special people. Be healthy. Be informed with ITD.
Try a big selection of KFC seafood items. And of course, we cannot forget your one and only favorite KFC original recipe chicken too. Hurry in this Lenten season. KFC, it's finger licking good.
9:46. Just real quick, let's get Lillian Posadas of the Guam Memorial Hospital on. Good morning, Lillian.
Good morning.
Half a day.
So we just spoke with Senator Teresa Lahi, who had basically confirmed that there was a case of exposure at the Guam Memorial Hospital with a patient who was admitted, who was exhibiting, I guess, flu-like symptoms, but the connection wasn't made that it could be COVID-19 until a later time. Can you just maybe just recap this?
Can I correct that?
Okay.
The individual did not come in with flu-like symptoms.
Okay.
Okay, he came in with a different complaint. So based on that information, we did not put him in an isolation room because there was no orders by the doctor to put him in an isolation room. We did, however, put him in a private room. So that kind of helps us at least contain it. And per CDC guidelines, if there are no isolation rooms, airborne isolation rooms, placing an individual in a private room with a closed door is sufficient. It minimizes exposure. And so, again, please make sure that we send that message out that there was minimal exposure to the public because the individual was in a private room with a closed door. What the high-risk exposure was, staff who had no knowledge that this individual needed to be in isolation, had, up close and close interaction with the direct and close interaction with the patient. And so those were the ones who were at high risk. It's the staff. If people were walking by in the hallway, they are at low risk for exposure. And the statement that the gentleman put out in his audio message that, we breached precautionary measures and we exposed the newborn, that is so erroneous and untrue, because the newborn are in a closed and an enclosed and contained and secured area on the second floor.
Lily and I can vouch for this, having had 5 newborns at GMH, so yeah.
But they're again in a separate area on the second floor, in a very enclosed and secured area. So the individual that we admitted into the private room was on third floor. He did not wander into the second floor to the newborn area. So again, very, very minimal exposure to the newborn. And even if you are walking through the hallway of third floor where that patient was, walking the hallway, you are low risk. Compared to if you're out in the public area in a mass gathering or a mass crowd with a lot of people may be talking to you and you don't know that individual may be COVID positive. So, the exposure risk is even greater in the community because we don't know what's going on out there.
When did this individual come into the emergency room, and then how long has he been in the private room?
He was admitted last week, and he's been there ever since he was admitted.
Okay.
And so were you able to do your trace investigation and deduce how many staff, which doctors and all that came into contact with this patient? And were the staff monitored? Have they been tested for COVID-19?
We are going through that process right now. Those who were in direct contact with the patient, yes, they are our employee health nurse and our infection control nurse is working with them and processing them accordingly. And they are being monitored. And yes, if they start manifesting the symptoms, definitely they will be swabbed and they will be tested.
Oh, so they have not yet been?
You know what? I have to check with our infection control nurse if they have. I need to verify that.
Right.
How many are we talking people?
I can't tell you because remember we're doing different shifts, and I don't know which ones and how many were assigned directly to handle this patient. Because some nurses they have several other patients that are assigned to them.
Lily, let me just ask you, with these.
I can get the numbers for you. Okay.
Thank you. Lily.
Appreciate that. With these, the staff monitoring them and they're not quarantined. I mean, if God forbid they're asymptomatic and they could still be transmitting, how are we mitigating that?
That's part of the protocol for CDC. Okay, if
Right.
you are exposed, definitely you will be quarantined. But if you're not manifesting any symptoms, you can still come to work and wear a mask. Even if and if you're quarantined at home, you stay at home. But if you're manifesting symptoms, especially if you're not manifesting symptoms, and although you had that exposure, wear masks. And we're making all the employees wear masks. Even our admin staff, we're all wearing masks here because we don't know who we could be encountering and could be a COVID positive person.
Mm-hmm.
And so we're also sending out a circular. We're also sending out a media statement. Again, just giving the assurance to the community that, there's low risk exposure to those who walk the hallway into the third floor. The very low exposure to the newborns because they're on second floor. It's those who were in direct and up close interaction with the patient that are more at high risk exposure. And so we're going through the process of getting them taken care of. And if they need to stay home, then they need to stay home on quarantine.
Lillian, where are we with the skilled nursing unit?
We have already transferred a COVID positive patient up there. We have some here that we are processing, but we want to make sure that, their conditions are not so much that their cardiac is going to be compromised. So we're trying to make sure that they really, truly are stable because, the critical period, as Dr. Ogden said, is 6 to 10 days. They could flip over to being really critically ill. So we want to make sure that we continue to monitor them here, and then we're going to transfer. There's a couple that are very, very stable, and so, we'll get them up to SNF.
How many patients do you have in the ISO unit? At GMH.
Here,
at GMH.
At SNI, here at the hospital, we've got in the ICU, and then we've got also 2 areas that we have modified. We took out the urgent care services out of the area that we call urgent care, and we've converted that. That's where the Ebola isolation room is. So that we've converted for the PYs that can be brought in directly, so they don't have to go through ER. So there's a few patients in there, and then in the Care 2, which used to be our special services where we do echocardiogram, we do EEG, we've discontinued or we've moved those kinds of services down just to the first floor. So that became a Care 2. So those individuals who then, after being in Care 1, PY, their test comes back positive, we move them into Care 2 because that whole area is negative isolation pressure. We've got a couple there too.
So how many patients are we looking at aside from the 8 confirmed cases plus the PUIs?
Total that we have here, I believe 5 or 6 that we have here.
Out of the 12 confirmed?
So we have 12 confirmed patients. Are Lillian, do you know, are all 12 of these patients in isolation?
Yes, they are.
Okay.
Absolutely.
And then what can you tell us about, you said 2 of the patients were very, very stable. What can you tell us about the other patients and their condition?
They're stable because they are in a closer monitoring area.
That's very good to hear, Lillian.
Is there anything else you wanted to get out to the public?
Again, I just want to try and encourage everyone. Everybody's anxiety levels and fears and are in panic mode. But, if we just take a deep breath and just be calm about it, be clear and level-headed and say, okay, this is all new for all of us. We're doing things as we learn and as it comes out of CDC. But, to have all this negative comments in the media, in the radio talk show, and people coming out, I'd like this one guy who made that audio message yesterday, that doesn't help us. We don't need to be more anxious and fearful. We are already all anxious and fearful, but we're learning and we're doing the best that we possibly can given our limited resources. So everyone just has to step up and say, okay, hey, calm down. So let's calm down.
Right. And I don't think anybody's being negative or has anything bad to say about you or the medical professionals and doctors and nurses over at the Guam Memorial Hospital or any of the clinics, any of the first responders. It's really not about that. It really is about the lack of detailed information.
Yeah, Lillian, it's really about, you ask 3 people the same question, you get 3 different answers.
So,
one doesn't know anything, another one says it's this, and then another one tells you the truth.
And so we're really grateful that we could just go straight to you and get the information.
Yeah. That's it. Let's go on facts. I'm not just take one little bit of information,
Right.
blow it up. That we contaminated everybody.
Right. Totally agree with you, Lillian. That was
you already have somebody who's
irresponsible.
Tone and Teresa Regis. Thank you, Lillian Posadas. You cleared up so much.
And I encourage people again to really just stay home, wash your hands, and do the things that needs to be done to prevent the further spread.
Okay, Lillian. Well, good luck to you. God bless. We know you're working hard, and we definitely appreciate it.
Everybody's working hard.
You got it. Thank you very much.
Take care, Lillian.
Lillian Posadas.
Okay, thank you, Sue.
Okay. Guam Memorial Hospital, 9:56. Let's go to our man
Dave, real quick.
In what?
Dave, real quick.
Yeah, let's go to our man in quarantine, Dave Sablon. Morning, Dave.
Morning, Chris.
How are you holding up, Dave? Day 2?
Just getting up, trying to get my day started. I kind of in and out of sleep last night and through the day. My phone was blowing up. Everyone trying to text, call, and check on everyone here.
Yeah. So
I'm doing good.
So what's it been like? Since we last talked, you got your breakfast.
Yeah, we had some temperature readings last night. They were calling people up and having them come down to the lobby to do their temperature check. They called me up. I went down, but there was a line of people, so I asked them if they could please call me when no one was there. I don't want to be around anyone if possible.
Exactly.
I think that's better proper protocol.
Did you ever get those rules and regs?
No, I haven't. Public health showed up here. Last time I checked was about 3:30. I heard a knock at the door. I kind of fell asleep, and when I opened, I noticed them downstairs. It was probably after 6 at that time. there was an incident maybe a couple hours after that. I heard commotion outside, so I went outside, and there's actually a retired fire captain, federal fire captain, retired, who's trained in hazmat procedures, and he had made a request for, I guess, some cleaning supplies for his bathroom.
So this gentleman is in quarantine with you, Dave?
Yes, he is.
Okay.
He's across the hall.
Okay.
So he was talking to the staff downstairs because I guess he wanted some cleaning supplies, and they had pointed out that they would have to clear it with public health for them to bring up the supplies. And he was grilling them, saying, "Wait, these people, you allowed them to bring us our breakfast and our lunch and water, and now you have a problem with them bringing up cleaning supplies." And I was telling them that their level of protection is not adequate for being in this situation. You know, they should be having more proper gear that they should be wearing aside from a mask. And, you know, the way this whole thing was handled from the get-go, if our plane and the passengers were deemed an essential threat to the island for anything that they suspected, then the handling of everything from the get-go was wrong. All that baggage that came off the plane shouldn't have gone onto the conveyor belt, because now if anything was contaminated, you contaminate that conveyor belt. And every other bag that came out after that flight, because not every flight is being contained. Remember, we're being contained. So remember, there's other passengers that will go through the regular baggage inspection, get their baggage, go out into the public. So if any of our bags or any other flight after us that is going to be quarantined has any virus on it, it's going to get onto those bags after going on that conveyor belt.
Right.
You just let it out into the public. The thing was, those bags should have been put on the tarmac and been decontaminated.
And just real.
I'm sorry.
Oh no, go ahead.
And you know, there should be already a tent outside. I mean, if the situation is that serious, there's no hazmat tent there. You know, even when they deliver the bags, the people handling the bags, all these people are being put at risk. And throughout the day, I keep trying to tell the hotel staff to please be careful. Don't handle anything from the guests. I mean, I recall going to get batteries earlier in the day for my aircon remote, and twice it went dead. So the second time I went down to Donnie, I believe is his name, really great guy helping us out. He gave me batteries, and I recall that the first time I went to request batteries, the guy took the remote from me, put the batteries, and gave it back. I said, "Thanks for giving me the batteries." I said, because the other guy, he took this from me, and if I was contaminated, he just took it. If he could also have been possibly contaminated himself.
So, Dave, let me ask you, after that retired firefighter chewed out the staff for not having the proper gear, waking up this morning, seeing them, are they now wearing the proper gear?
I haven't been downstairs. Okay. I just got my breakfast, and they're just wearing face masks and gloves. So I don't know what is proper gear, but he said they weren't adequate enough.
So they deliver your meals to your room. You don't go downstairs and okay.
No. If you don't answer the door, they'll put it outside.
What was for breakfast, Dave?
I had mixed greens. I had some asparagus, boiled egg, a couple strawberries, a slice of orange.
Are you on a special diet, Dave?
I actually requested for that. I mean, I didn't request for this breakfast, but I requested to, you know, not just for myself, but I point out there's other people in the building that may have special needs. They're great and accommodating dinner last night. They brought fried chicken and mashed potatoes. You know, I want to thank my cousin Joey Atalik and the food truck, because they're doing a great job of trying to keep us nourished here. He called me last night to see if everything was okay. And then they called me this morning prior to me getting my breakfast and told me what the lunch menu would be and the dinner menu. So it sounds like it'll be okay. I mean, I think it's pasta primavera for lunch and marlin for dinner. So they're taking care of us in that regards. I mean, as far as my needs, I'm not sure about the other people, if they have addressed any of their needs diet-wise. What was I going to say? And the concern the fire chief, fire captain retired had also was the handling of, you know, because he wanted to clean his bathroom, but you know, because at some point they're going to have to collect the laundry, the used towels and stuff. That is supposed to be treated as hazardous material. You know, because people use it. People that are potentially virus carriers have used these things. So now those those bacteria might have been transferred to that. So who's going to collect that? How are they collected? Are they going to be properly trained collected? Because if not, then you're not. If not, and they were to contract something, then you're just spreading it out into the community when they go home. That's his big concern. Is these people that checked us in yesterday at the front desk was hotel staff. These people aren't properly trained. They shouldn't even be here. You know.
Yeah, it should be like public health people. I feel like,
this is
right?
a government function. This building was seized for a government quarantine zone. There should be government personnel that is handling this. So throughout the day, last I saw about 3:30, right before then, there's still no public health. I inquired again about them so I can allay my concerns. They said, oh, they left. They would take care of business, whatever. They'll be back. But they were supposed to be back at 12, according to them, and they were supposed to be relieved. And then they said they were told that at 5 p.m. they'll be back. So after 6:30, when I got up and looked outside, they were there. I don't know if the hotel staff is still around, but they said they might still have to be around to show them how to run the front desk operations.
Right.
But I haven't seen since.
Dave, where are you? Your state of mind, man. As a rough first day, to say that's kind of putting it mildly. But waking up today, knowing that you have 13 more days to go in this situation.
Well, we'll see how it plays out. I mean, I'm just really concerned with the people that have already had contact with us and whether they were possibly infected and if they went home and took it home, because that's what one of the front desk staff is telling me, that he's going to go home. And the fire chief, like I said, these people, when they process us in, we have to provide a paperwork that we got at the airport. Now that paperwork is potentially contaminated material, which all of these things, as you know, he's a trained hazmat in hazmat operations. These are things that I just saw throughout my day and coming here and seeing how things was handled. That I had issues with myself, not issues but concerns, because this is a quarantine zone and they're trying to contain anything that's here and keep it here. Now, if people are already breaking protocol, then you're probably not. You're not doing it right, and you're probably being, making it more of a potential hazard by bringing it back into the community by having people who aren't properly trained. I thought that when I got her, I should have some sort of sanitizing kit, and that's what he also pointed out, that when we got her, I mean, there should be some alcohol, some wipes, some Clorox wipes, some rubbing alcohol or hand sanitizers or anything because that's what I wanted to do. Anything they give to me, I sanitize. I'm running out of my alcohol spray. I didn't bring a lot because I didn't think I'm going to get quarantined.
Yeah.
So those are things that we need, at least I need, to feel safe, because I go down there and I in an area where someone previously was before me to get tested, and this is real. This really hits home. This is happening on our island. I've seen it blow up in the States. Last night, New York just jumped up like 1,000 people.
Yeah, I think nationally there was a 40% increase in the number of confirmed cases. So.
Yeah, and thank God that the president just signed a national. What was it?
It's handing the government over to FEMA. Yeah, as an emergency. I think it was like a further declaration.
Yeah, the Defense Production Act, where you can force businesses to speed up production on the gear that our frontliners need.
Yeah, and I mean there's a shortage everywhere, not just here.
I heard you talking about them coming up with a way to make masks with surgical gowns. I saw that last night. I mean, that's how dire it is. That these people are saying, please, I don't know what he was waiting for. I mean, it's not like a lot of these things you can just produce every night. I mean, respirators, ventilators are things that they are sorely needed for the elderly, and they're in short supply. It's a scary thing that Italy is at the point where, they're choosing who gets to live and who gets to die. I don't want to see that come to our country.
Yes.
We're the United States. We're part of the United States, the greatest country in the world, and we can't even do that for our people.
Dave, thank you again for your time, and you keep us posted, all right, and God bless you.
Thank you. You guys have a great day. Be safe.
Take care.
Our quarantine correspondent, Dave Sablon. He is currently sitting in quarantine. You had something that you want to read out from the bank?
Yeah, before we close out, we're getting information about banks, and I know that a lot of people want to know about that. Well, Bank Pacific, in the spirit of the governor's executive order, they'll be temporarily reducing their hours from 10 a.m. to 3 p.m. Monday through Friday. The bank will also be temporarily closed on Saturdays. I know we have something from the Bank of Guam as well. I think you might have it on your phone.
Oh, really?
Here it is. Okay. Oh. I have too much storage on my WhatsApp. Bank of Guam. I don't want to go without mentioning this because I know a lot of people are with the Bank of Guam.
Yeah, I'll say.
Okay, Bank of Guam. In keeping with their commitment to do their part and putting the people first, they've implemented a deferment program for all of our customers with existing consumer loans and personal credit cards. All personal loan payments will be deferred for 3 months, regardless of account status. All personal credit card payments will be deferred for May, June, and July, also regardless of account status.
Thank you, Bank of Guam. Thank you very much. No, I mean, that's very, very major relief. I know I'm not the only one who was sitting here thinking, how am I going to make these payments on these 2 loans before we go into social isolation orders? So that's good news.
And also Coast 360, I'm also offering a 3-month deferment.
All right. Well, it seems like it's almost like monkey see, monkey do. So which one of the banks is going to be, hey, do I hear 6-month deferment?
Stop.
All right. Hey, just wanted to end it on a light note, Bree. Very, very heavy show. Hey, a lot of information. We had a lot of big reveals on this morning's show, so please watch it, share it, get that info out there. Sabrina, it's been a great week here with you. Well, as great as it could be.
Yeah. Nice working with you.
Right on. Okay. Air fist bump. Yep. Social distancing. Hey, this has been the K-Wave News takeover containing COVID. We're going to take the weekend off, but of course we're going to be working very hard to give you all the latest information.
Edition, so.
Yeah, and we're coming in Monday morning, and we're going to be sure to adhere to all the social isolation mandates that are out.
And you should too. 12 o'clock today.
Right. So for Sabrina, Salas, Matanane, Guahusi, Chris, thank you for listening and watching. Adios.
Bye.